I'm going to call this meeting of the Gloucester School Committee to order. I'll remind everybody that the mission of Gloucester Public Schools is for all students to be successful, engaged, lifelong learners. This meeting is recorded by video and audio in accordance with the state open meeting law, consistent with the governor's orders suspending certain provisions for the open meeting law and banning gatherings of more than 25 people. This meeting will be conducted by remote participation. If you are calling in on a phone, you can press *9 to request to speak. If you're watching on a computer or device, there is a raise hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. We'll need a roll call, Maria, of the school committee to register who's in attendance.
Mr. Favazza.
Present.
Chairman Pope.
Here.
Ms. Prince.
Here.
Mayor Taken.
Here.
Ms. Watson.
Here.
Ms. Weeson.
Here.
And Kathy Clancy.
Present.
Okay. I will now ask you to join me in the salute to the flag. Okay. Can you see that?
Not yet.
Not yet. Now?
No.
Oh, well, don't understand that.
Jonathan, I just made you a co-host, so try it again.
Okay. How's that?
Yes.
Pledge allegiance
Yes.
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Now I got to get out of it, right? Sorry about that. Trying to get out of this. Here we go. All right. The next order of business is oral communications. I know there are a lot of people here that are concerned about our plan for reopening school. And because that is on the agenda tonight, and we need to have the presentation from the administration, and we need to have the opportunity for the school committee to ask all of the questions that they want. I am not going to allow oral communications regarding the reopening of school this evening. That being said, next, there are a number of staff meetings that are going on between principals and teachers, as well as family focus groups that are going on with the superintendent, as well as we understand that we will be having to impact bargain with the GTA. There are a lot of moving parts here. But that being said, next Monday at 7 o'clock, we will have a special school committee meeting at 7 o'clock where, which will be for the sole purpose of getting input from the community about our plans to reopen. The following Wednesday, a week from tonight, we will be required, the school committee will be required to endorse a plan for reopening, which has to be submitted to the state as they have requested. And that is something that we are obligated to do. So although there's still a lot of moving parts, we are doing our best to try to get a handle on the safest and most effective and efficient way to reopen school and deliver education to all the students of Gloucester. So that being said, if anybody would like to address the school committee on a subject not on the agenda, meaning not on the about the reopening of school, raise your hand. Okay. Matthew Lewis.
Thank you. Can you hear me?
Yes.
Thank you. I would actually like to take this time to say that I hope that you continue to be forthright and public and transparent in all planning for reopening of schools. I appreciate the hard work you and the school committee have put in it, and I look forward to a continuing dialogue on Monday.
Thank you very much. Cynthia.
Hi, Jonathan, members of
Hi.
the school committee. I just want to publicly say that I oppose your revoking the rights of people to their free speech and statements about reopening of the public schools. This is supposed to be a forum that we are to be commenting on what is on an agenda item, and you're not allowing us to do that. And I have issues with that. That's not supposed to be how a public meeting is handled.
Okay. Cynthia Michkowski.
Hello, yes, Cynthia Mahowski. I also am opposed to you not allowing, I feel like somehow that's a violation of the open meeting laws to not allow us to comment when it was on the agenda and to do so last minute. I also would like to request that if, that all the, that also too, that all speakers, all school committee members, that you put this in grid format. Somehow I feel that just seeing one speaker at a time does not, is not helpful. If I were in a true open meeting, I would be able to see each school committee member. I feel like there's something, see all members present at the same time. The other part of this as well is that any decisions about conducting business regarding the reopening of school, my suggestion is that next Monday when you're doing this, that you all meet in person to conduct business. You can still do the meeting remotely by Zoom. The audience can still log in, but my suggestion is all the school committee members meet in the same area physically, 6 feet apart with masks on, to discuss school business that we may be doing. Thank you.
Heidi.
Hi, my name is Heidi Wakeman, and I am very grateful for this opportunity to share my opinions. And listening to my colleagues, I will also echo that it is hard to have a meeting when I'm not looking at my representatives. I'm a citizen of Gloucester as well as an employee of Gloucester Public Schools. And my thoughts today have mostly been about weighing my safety, my family's safety, my extended safety versus the education of our beloved public school students. And this is a difficult choice to be faced with. And I look forward to participating in this conversation, listening to what you have to say, but also being heard. And my question to you is, what if it were you? If you were a teacher, what would you want to do? If you are a parent in public schools, what would you want for your son or daughter or child, or your grandson or your grandchild? This is a challenging time for everybody, and I know there's no easy answer, and I respect the work that you do as elected officials. I love our city and I love our students and I love the opportunity to serve, but I feel we are also in a very, very difficult situation, and hopefully we can learn from other school districts that are going through this as well, in other states, in other parts of our state, and we're not alone. So I support you, and I also support our teachers and our families, and our students most of all. Thank you.
Mr. Chair, just a quick question on the
Yes,
very
Joel, what?
issue. On our end as users, we get to select whether we want people in gallery view or speaker view. Are attendees, and you might not know, Grant, if he's listening, might know, are attendees able to select which view they want, or are they stuck reading whatever we put out?
I don't know the answer.
I can
Maria?
enable gallery view if you'd like that for the public.
Absolutely.
I will do that right now.
Okay. And we will, later on this evening, I think under new business, we'll have a discussion about when we need to return to in-person school committee meetings. So that will come up later on. We have a couple more. I would like to just reiterate that we're, we have a long meeting ahead of us. We've got a lot of questions ourselves. So we understand this is very important to everybody here. But Teresa, go ahead. Seem to have lost Teresa. Rachel. Maria, what's happening is when I recognize these people and I allow them to talk, I'm getting a thing about promoting them to panelists.
You can promote them and then remove that after.
Okay.
Like,
All right. I lost Teresa somehow. Rachel.
Rachel, you're muted. We
Yeah.
can't hear you.
I got it. All right. You'd think I'd be better at this with all of my remote learning and Zoom school. Good evening, members of the school committee, Mayor Taken, Superintendent Lummis, Assistant Superintendent Bach, teachers, community members. I'd like to thank you for the opportunity to speak. I, with my fellow colleagues, am in opposition at being unable to speak. I have a statement prepared. I was hoping to speak about the reopening, but that's been shut down. And I'd just like to let you know that I look forward to seeing many of you at the bargaining table where we can negotiate a fair and safe way for all of us to resume the learning. Thank you so much.
Okay, thank you, Rachel. Eric.
Are you able to see me or hear me?
I can hear you.
Okay, well, that's fine. Thank you very much. Eric Lee, strongly opposed to the fact of having an open meeting here where it says oral communications and not being allowed to speak or present any view. The irony of the whole situation is the fact of if a student were to come to us and we had new material that was coming out and we were to put our time in as teachers, we would stay as late as it would take. No questions asked and continually do it. From what I'm hearing, this is about a time issue, and it just is unacceptable to me that when there's such important issues coming up here that you're not allowing the public to speak on the matter at hand. I just want to voice my opposition to that. Thank you very much. I will be here on Monday.
Thank you, Eric. Okay. Marge. Trying to unmute you, Marge, but it's okay. I'm not sure why that's not happening. We'll move on to Amber.
Hi, my name is Amber McGlynn. I also just wanted to oppose the fact that in a public forum where we are supposed to be allowed to speak, we're not being allowed to voice our opinions about a very important matter that not only affects our students at Gloucester High School, but our staff, and not only our staff, but our staff's families. I don't live in Gloucester. I understand that the numbers are down in Gloucester, but there are many teachers who do not live in Gloucester and that will be coming to the school. So I also look forward to talking to you all and seeing you on Monday.
All right. Okay, we understand that people are upset that they're not going to be able to speak tonight. But as I said before, our objective is to understand the plan right now and for people to understand the plan before we get input as to what's wrong with it or what's right about it. And that's the purpose of tonight's meeting. And if you look at our agenda, it says right at the bottom of the agenda on every single one of them that discussion about items on the agenda are only allowed at the discretion of the chair. So, and that has been the decision that I made for us to move forward. We're going to be actively engaged in this whole issue for the next 7 or 8 days. And it's not going to be, and people are going to have a chance to speak. But we need to listen to what the administration is planning before we know, can make a judgment on the validity of people's concerns. So, Rebecca. Rebecca. Okay, moving on, Beth.
Good evening, and thank you so much for all the hard work that you do. It's much appreciated. I know everyone's already voiced their opposition. What feels badly to me as a member of this community, as a resident of Gloucester, and as a teacher, that it feels like you're not interested in having other people's thoughts to, not just to argue with after you present it, but to have input into the planning of it. And that does not feel good to me as a resident and as a teacher, that you don't seem interested in what it is we are interested in sharing with you until after you've already presented the whole thing. So I may be wrong about that. I appreciate it, and I will be here Monday. Thank you.
Jonathan, can I just
Go ahead, Melissa. Oh, Samantha, sorry.
No, Sam, go first. Yeah.
I think maybe just some clarification might be helpful. So the school committee hasn't been on the reopening committee, so this is the first time that we've actually had a chance to provide input on the plan. Maybe Ben, at some point before you present, you can sort of list who is a part of the reopening committee so that people understand how many different players were involved in the process. So this is the first time that the school committee is fully hearing the plans. We have read them and had time to sort of digest them just as much as the community has, because the website and the email went out at the same time. So this is the first time that we are able to have our own questions answered, which is really important because we are then going to have to endorse a plan next Wednesday, which will be after we hear people's feedback. which I think is really important for people to understand. There will not be a decision made tonight by any means. So I just think that clarification might be helpful. I think people might assume that the school committee has been a part of the reopening committee, and that's not the case.
Sam, just to respond to that, slides 15 through 22 will document exactly the very wide range of folks who've been involved in developing and helping to develop the planning.
Okay, Melissa?
I just want to talk about a process issue too, because it seems like the past couple of meetings, people have been coming on telling us how we do business. And I just want to remind everyone that the school committee is obligated to do their business in public, and that's what our meetings are. And it's our agenda, and we set the agenda, and we set the policies of how we work through that agenda. And it has always been a policy that it's the chair's discretion to take public input on a topic on an agenda, and this is not the first time we've done this. And that it has always been our process to put information out there and then ask for feedback. I mean, to get feedback before the school committee has even heard anything about this plan other than seeing what's up on the website like the rest of the city, I mean, seems a little unfair for us to be driven with opinions before we get to see what we're even trying to form an opinion on. So just a friendly and respectful reminder that, like Samantha said, we have not heard about this yet tonight, and we're going to ask questions, and we'd like to get on to that as opposed to being told all night long we're disappointed in not hearing from everybody. We've made a solid plan that we will hear from everybody. There's numerous meetings coming forward after tonight to get feedback. But that right now, what's most important is the administration presents that plan so that the school committee can start talking about it other than just reading about it like everyone else is. It's unfair to me to get opinions before the school committee has had a chance to even see what we're getting opinions on. And I'd like to start that as soon as possible and postpone any further public comment to the end of the meeting so that we can start this process, because it's going to be a long night with a lot of questions, with a lot of information to get out to the public.
Thank you, Melissa. We have one more person I'm going to allow to speak, Rich Bean.
Hello.
Hello.
Hi, so this is actually Jessica Bean, and I am a teacher at Gloucester High School, and I also have a child that's going into O'Malley next year. And I did want to oppose that you're not allowing the community to speak, and I wanted to speak to the fact that there isn't clarification or a clear plan on how we're going to give our feedback. And I think if you have that plan, it would be helpful to state that now. And also, the school committee is here to represent the people of Gloucester. And so I think it's important that you get the community's input, and that's also how you make the decision, instead of being told that we can speak after you've had input. We are a community, and you are supposed to represent us as a community.
Okay. All right, we're going to move on to the next item on the agenda.
Jonathan, do you think some people might have signed on late so that they might not have heard that we're going to have a public forum where people are going?
We can run through that, but all the teachers, and Ben, maybe you can help me with this. There are going to be staff meetings with the principals in every school to discuss the plan and get input from teachers. There's going to be community forums with parents, and all of these are going to be happening in the next few days, as well as on Monday night at 7 o'clock, next Monday, we will have a public input forum. And I don't know really how, why people are referring to a school committee meeting as a forum. It's a school committee meeting, and we have our rules, and we abide by them as best we can. We're not trying to deprive anybody of the ability to talk. We're just trying to put it in the proper order so that we can get a better understanding of what the situation is and what the conditions are which are going to allow us to educate students in the fall. And
So John, thank you, John. Let me add
Yeah.
that what I'm sharing now on the screen, I think people can see it, are the schedule of all the public forums that are coming up over the next week or so. You'll see we have 2 scheduled for each of the grade levels. So O'Malley Elementary, Gloucester High School, and the preschool. Plus, as you announced tonight, the school committee public hearing or special meeting for public comment on the 10th, which will be devoted only to getting public input and comments on their proposed plans. And just also, as you mentioned, staff meetings have been happening this week at all the schools. They'll continue to happen. They've been very fruitful in a lot of ways, just in terms of helping the staff, and we've had great attendance of those. I've participated, I think, in 3 of them, but a chance for folks to ask questions and get more information. And so it's been a good format, or helpful format at least, for the principals and myself to listen to those. But those happen more. So a lot of opportunity for folks to ask questions, hear more about the plans of next week. Of course, school committee members can participate in all the public forums as well. So we do intend to get quite a bit of input along the way. And later tonight, when I'm sharing, I'll talk about other folks who've been involved in all the planning.
And then how are they going to get, is it going to be an email that people will get a Zoom link to? How will people know how to get onto those meetings?
Great. So it's already on our Back Together GPS website, and we'll send out also an email late tonight after this meeting to all families with that schedule as well. We were just waiting to finalize the preschool schedule, which we did yesterday, and we'll get that notice out tonight for folks as an email to all families. But it's also on the Back Together GPS website, right on the front page there, I think.
Thank you.
Okay. All right, we're going to move on with our agenda. The next item is recognitions. Does anybody have any recognitions that they'd like to bring forward? Kathy?
Well, first, I know we've, at many of our meetings, we've recognized the teachers and how hard they've worked in their participation, both in these working groups and all that they have done in the spring. But I wanted to have a more community-oriented recognition that does involve our schools to some degree, but the organization or the group of people called We're in This Together Gloucester have stepped up and done simply amazing and generous and thoughtful things for so many in our community. They deliver food to people whose family members might be dealing with the virus or dealing with something else. There's just so much that happens behind the average public eye. So unless you know of certain situations, you don't know all the great things that they are doing. And I also want to recognize so many of our counselors at our schools who in the summer are still helping kids with personal situations that are sometimes often very sad or very trying for them. And I just want them to know we appreciate their dedication to our students 365 days a year.
Okay, anyone else, recognitions? Okay, we'll move on to the consent agenda. Are there any items on the consent agenda that anybody would like to remove for further discussion? Okay, seeing none, do we have a motion to accept the consent agenda?
So moved.
So moved. Second.
Second.
Okay, Maria, roll call vote?
Mr. Favazza,
Yes.
Chairman Pope,
Yes.
Ms. Prince,
Yes.
Mayor Taken,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
and Kathy Clancy.
Yes.
Okay, it passes unanimously. We'll now move on to the superintendent's update on plans for school reopening and reentry. And I will hand it off to you, Ben. And Carol. Carol is here with us tonight from the Board of Health to give us an update on the general situation. So thank you. It's all yours.
Great. Thank you, Chairman Pope. I will attempt to have less. Are you seeing a Back Together GPS slide? Okay, great.
Yes.
I am, so this is going to be a lot of information, everybody. So hang tight. Crew members, please ask questions. What I'll do is I'll go through different sections, and at the end of each section, I'll pause and give you some time to ask questions as we go along. As you can see here, there's a lot to cover. I apologize for the length of it, but as you can imagine, as you all know, I should say, this is an extremely complicated work we're all trying to do these short couple months to get the schools and our staff and the city ready to return to school. So I'll go as quickly as I can here. So our primary objective remains the safe return of as many students as possible to in-person school settings to maximize learning, address our students' full needs, and support community and family needs. What we are all also aware is that our students learn best, are supported best. They're one of the safest and healthiest places they can be is regularly in school, in our school buildings with our incredible teachers. That creates schedule for them, it creates consistency, it creates support and learning, obviously. We also know more than ever how being able to be in school supports family needs and supports community needs. So we're really looking at all of those. Our top priority in planning is absolutely the health, safety, and education of Gloucester's children and the health and safety of families and staff. We know that our students learn best and we're able to support their mental, emotional, and social health best when they're in our schools. It's really important that folks understand we're aiming to minimize risk to students and staff as much as possible, knowing that the risk can never be reduced to zero. Driving our car is risky, as we all know. In fact, it's actually probably one of the more dangerous things we do every single day, but we do it because we know how to minimize the risks. We go boating, we go sailing and surfing. Those are dangerous things as well, but we minimize the risk. And so we really have to focus on the health and safety data, on learning from other folks and minimizing risk the best we can and making good choices about that. All our decisions regarding the reopening of the Gloucester Public Schools are going to be based on the guidelines set by the Massachusetts Department of Public Health, and also the Massachusetts Department of Elementary and Secondary Education. We're working very closely with the Gloucester Health Department. Karen Carroll is here tonight. She will give us an update on much of what's going on in terms of community transmission. Massachusetts, as we all know, is doing just about the best in the country, and that's because of the great guidance we've gotten from our governor, our state officials, our public health officials, and also because our community members across the state, and especially in Gloucester, have been doing a great job abiding by those guidelines and those recommendations and regulations. And so that combination has been really strong, and we hope that strength will continue, that safety will continue, and we're really leaning on the guidance both from Karen's staff and the health department here in Gloucester, but also Department of Education and also the state health and public officials. So I want to just start with, we started many presentations this summer with Karen giving us an update and telling us what we need to know about the health situation in Gloucester and her guidance on how we think about reopening and reentry. So we're going to begin there tonight as well. So Karen, I'm going to shut down the sharing here for a little bit, and we'll turn it over to you just to give us an update on anything you want to give us an update and tell us what you're working on. Thank you.
Great. Thank you, members of the school committee and the public, for the opportunity, and Mayor Taken, to join you tonight. I have been involved, so thank you. It's great to have open dialogue with our school community. For those of you who have been involved in other reopening committees throughout the city, you know that we've been at this for a few months now with other industries. The state had a phased reopening plan. At phase 1, 2, and 3, we're now in phase 3, in the latter part of phase 3, and hopefully continuing on that path. But having said that, the state watches certain key indicators. Part of their reopening plan was to establish these 6 indicators that are public health indicators. They're very similar to the World Health Organization's indicators that they're using for returning to reopening phases. And they're all about, when you can change from the detecting of a few cases that are ill to detecting all of the cases and isolating them. So we're in that part of the plan and reopening communities. And also we need to have the ability to sort of control the level of transmission, as well as sporadic clusters need to be minimized, and we need to be able to get to the known source of clusters. So these are all public health lingo that we spend a lot of time thinking about. The state uses 6 indicators, as I mentioned, and they have a sort of green light, red light system. And if you go on their mass.gov website every day, they're updating the data, and they're showing which indicators we're in the green, which means progress ahead, we're moving in a positive direction, which indicators are yellow, of which 3 of the 6 are still yellow, 3 are green, 3 are yellow, and none are in the red. Red means we're moving showing a negative trend somewhere. These are things like the positive test rate, that's in the green, testing capacity, and hospitalization numbers. The yellow currently are the number of deaths, the number of the healthcare system's readiness, and the ability to contact trace. Again, these are similar to both the federal plan for reopening as well as the World Health Organization. So some of these indicators are used fairly standardly throughout the world in order to assess whether or not a community is ready and safe to reopen. There are 6 kind of main indicators that we walk through as well, but we've talked about a lot of them with our state governor's website. So at the moment in Gloucester, we have, to date, there have been 315 cases of COVID-19 diagnosed and reported. That's about 1% of our population. At the current moment, we have 6 active cases. And to date, since the onset of the pandemic here in Gloucester, so January, February, whenever that timeline was, we've had 26 deaths due to COVID-19 for the residents of Gloucester. So, and again, the bulk of those deaths occurred in long-term care facilities, and that trend mirrors what we see in both the state data as well as the national data. Approximately 60 to 75% of all deaths from COVID occurred in long-term care facilities. So that is our high-risk area in our communities. Our senior population is the population that was hit the hardest. I think you all know that predominantly the hospitalizations and the deaths have been older people in our community, often with an underlying health condition. At this point, the state of Massachusetts is reporting 0 deaths in the age category under 19. So that's our school children population. That's not to say that there haven't been cases within that age group, but they have not resulted in deaths, and they are not a significant part of our hospitalizations and no deaths. So in terms of Gloucester,
I think you just froze up, Carol.
Can you guys hear me, or is it me? Is it me or you guys? Okay, so it's Karen.
I can hear you, Melissa. We can't hear
Okay.
Karen.
Usually I do this. That's why I thought it was me.
See if this resolves itself.
I just text her to let her know.
Okay, thanks.
She may be coming. She may be trying. She may be shut down and coming back in.
Sorry, gang.
Okay, you're back.
Internet connection. Yeah, I'm not sure where you lost me. I think I was talking about the community transmission in Gloucester at the moment is being very low. The number of active cases are low. And starting this week, we will be testing our wastewater for the city, and also it will include some of Essex wastewater as well. And we're really excited about this because it gives us the opportunity to watch the community level of transmission in real time, ongoing. It'll be weekly testing through to the new year. It's being done by a company called BioBot, and they are doing this in many other communities throughout the state, as well as the country. And it allows us to know very early on when we start to see the increase in the virus in the community. And without getting into too many details, the virus is shed through fecal matter in the early part of the infectious stage of the disease. So sometimes even a day or two prior to someone having symptoms, we start to see the virus shed in the fecal matter. So we're able to really track and see, and by probably a week from now, we'll have a baseline for our community. Frankly, this is holding a lot more promise than the actual testing of people and cases, because we can't test on any sort of mass level in our communities right now. Again, we establish a baseline. We compare that baseline to other communities who are also doing this testing, and we'll be able to gauge the level of virus in our community. So our team will be watching that with the Board of Health really closely. And again, that's just another level of security we have locally to watch these numbers. Now, also, I don't know how much you all know about the way in which our cases are reported, but anytime there is a resident of Gloucester who is diagnosed and has a positive test, that result comes through to our health department, who goes through a process of contacting the patient, the index case we call them, isolating them immediately within 24 hours, because we're a 7-day-a-week operation. And then we contact trace everyone that person has been in close contact with, and that's defined as 10 to 15 minutes within 6 feet of someone. So, and it doesn't sort of distinguish between indoor and outdoor, or mask wearing or not mask wearing, but we do know mask wearing absolutely does slow down the transmission of the virus. So at the moment in Massachusetts, our positive test rate is 2.2%. It's up a little bit from where we were a month ago, but again, it's not a sign of a spike. It's not indicating a significant spike at this point at the state level, but DPH is watching it closely in conjunction with emergency room data, hospitalization data. So they're talking with their emergency rooms daily to see. We also talk with our 911, our first responders daily. So, because often they know if they're seeing an uptick in transportation for COVID-like symptoms to the hospital, or they're getting an uptick in calls. So there's a lot of ways that we monitor this. We have since day one, and we will continue to. And it is a daily, 7-day-a-week, very close monitoring. We've also had staff designated to what we call clusters, which is whenever there is more than one case in a facility, in an agency, we refer to those as clusters. And we want to track those really quickly. We want to isolate everyone else and quarantine anyone who might have been exposed. So we have a nurse on our team, our contact tracing team, who is solely designated to these clusters, and we will continue that through the fall, especially as schools open, so we can provide really fast support should you need it in any of your schools. As you know, with this thing, the quicker, it's all about isolating and removing the index case or the contagious person, and then the people around them that might be asymptomatic carriers need to be quarantined as well for a period of time while they are potentially still developing or could develop the virus. Unfortunately, it has a really long incubation period of 2 weeks. So, we have a long time. It's a lot worse than the flu in that sense, in that there's this time in which people can be asymptomatic but have been exposed and be carriers. So there's a lot of challenges about this virus, But the main thing we know is it's transmitted through close contacts with through humans. Most of the transmission is when people are actively symptomatic in a very classic sneezing, snotting sort of way. Can you hear me all? I froze again. Okay. It's hard to tell. So again, most of the transmission happens that way. So one of the really, really important things in reopening any of our businesses, any of the city buildings, has been to educate your employees, your staff, your customers, your clients, your students, your parents, that when someone has the symptoms and knowing what those symptoms are, they need to stay away. And that is how we'll get on top of this thing and stay on top of it. It's really important that the community, the school community understands those symptoms. Some of them are very subtle. They differ in children to older people, and is prepared and comfortable to not come to work or school if they are exhibiting those symptoms. So I talked about the 6 indicators. Again, at the moment, we see low community transmission. I know a big question is, what is the point in which we will close schools, or we will close restaurants, or we will pull back? The Department of Ed, DESE, is coming up with some guidelines, some indicators and measures that they would like to use. Public Health has its own set that we'll be watching really closely. And all of those things will come together. And I think when we have more widespread community transmission, we'll know it, we'll see it, we'll know it, and we'll have to make decisions accordingly about either pulling back. We don't go from open to shut.
We lost you again, Karen.
I know, I'm sorry, our internet tonight is just packing it in. And so I think that's probably all I'll touch on. Maybe just a little more about testing. Testing, and again, why we emphasize symptoms and prevention. If you have symptoms, if you've been contacted, if you're a close contact, we want to keep you away until you're safe to return to crowds. That is the number one. Like all things in public health, prevention is going to be the best way to approach this. Should we have exposures, people will need to get tested. Their doctors will order that test, and we'll go through a process of contact tracing, which is like I explained for the other industries. Testing is a challenge. You know, we have some options, but right now we are seeing some significant delays in our routine public testing, due largely to an influx of tests coming from other parts of the country who are inundated right now with COVID. So there are challenges there, but we work daily with the state lab. If we see glitches or we see significant delays, we are reporting that to the state. They are investigating, they are calling the lab and saying what's happening here, why the delay. So we're really working to understand all the potential components where there are delays, and then as soon as we have cases, we're reaching out to them within 24 hours to contact them. If we can't reach them by phone, we're hand delivering a letter asking them to call us, and we have a very good response rate to that. So I really feel very confident about our ability to contact trace once we know someone is positive or exposed. I don't feel as confident about the time it takes for that test result always, and it does fluctuate. After the 4th of July, oh, damn it, lost me again. Oh, am I here again?
We can hear you still.
Okay. You know, it fluctuates depending on the time and what's happening. So after the 4th of July, things were very slow and they improved. Now they're back again. So we'll see how we go moving into the fall, but we're constantly pushing for that, for improved testing, for local testing, and for more options there. There anything else that you want me to cover? Yes, I see some questions. Melissa? Sorry.
Melissa?
Yep, thank you. So two quick questions that I have for questions, and I know a lot of people in the public have asked them. So one, you talked about, first of all, thank you so much for being here tonight. This is very helpful and much needed to start this meeting off this way, hearing about health and safety. So the question, one of the questions out there with everybody is, you know, at what point, at what data level do we make a change in the way we do business? In other words, I know the governor has his plans going from phase 3 to phase 4 or back to phase 2, but is there some sort of standard or some sort of threshold set that we know will be changing the way we do business? That's one of my questions. And then my second question is about testing. So I've heard two stories today. One about someone who had to go get tested, and I guess the closest place is Beverly, and it took almost a week to get a response. However, today at the beach club, I also spoke to a woman whose daughter had to get tested. She went yesterday to Beverly and got her results within a couple hours. So I'm hearing mixed messages about the turnaround of testing, which of course is a concern to everybody, because if we have to shut down a school for a week waiting for a result of a test, that's kind of ludicrous. So my second question is there an ability to get testing closer than Beverly, say in Gloucester or close by, with a quick turnaround? I know we have those rapid tests available, but is there a way for Gloucester to get access to that so we can get responses to testing sooner if the choice is to go back into class? So data level, standard, and testing are my two of many concerns I have.
Okay, so the data levels, the specific indicators, and to what number and what level DESE has promised are coming forward, that they're setting those in conjunction, hopefully, with DPH. So they will be developing their criteria. I have not seen them yet. As soon as I do, I'll let you know. They're very likely to be some of the same indicators that I just mentioned that are to do with community-wide transmission. The main one is that positivity rate. So of the total people being tested, what % of them have COVID? And that's a really good indicator, and that's likely to be one of them. And then, you know, internally, you have to figure out what can you do, you know, at what point, if you have a certain cluster in a building or in a classroom, how do you manage that, and how do you address that need, you know, that specific need in the short term. But I think those indicators will be coming, and I can let you know more. And then we have indicators that we're looking at as well all the time. So as I said, there'll be a lot of discussion, and a lot of these indicators are on mass.gov every night. Every town's data is there. Every nursing home is published. The state has been pushed, like everyone, to have a lot of transparency here, and they have. And you know, we're gonna be getting a lot of data that will indicate whether we're staying at a level that's low and safe, or whether that we're spiking into something else and need to take some steps back. In terms of testing, so there's a lot of confusion. I'll try to do this quick, but the rapid test you referred to, someone got quickly, that's an antigen test, and you get the result in 15 minutes. It's not accepted as a way to clear someone to return to work or school. It's also not accepted for the travel order. And the reason it's not accepted is it's not quite there yet as a test. It's not predictive enough of, is someone really with or without COVID? So, but people still do them. They think because they're rapid, and some employers accept them. It's a real challenge for us because they're not an acceptable level of testing, and they are the only rapid one. The rest get sent out, except the hospital has its own, you know, they can test someone in their hospital and get a result straight away, which is a good thing. They need that, but that is not open to the general public testing. So the only way to get rapid PCR testing is what it's called, is the gold standard test. And that's actually checking for the virus's genetics, the RNA, is to have one of these special, you might have heard Abbott machines or Cepheid machines. And there are some people on Cape Ann exploring that, but there is a wait period for them. and they're very expensive. We do have some other options, like when the National Guard comes, or if we have any government-funded testing of homeless shelters. We were able to have congregate sort of mass asymptomatic testing throughout the summer of some of our high-risk congregate living sites and populations. Again, that was a government-funded thing. It's very expensive. Thousands and thousands of dollars, and but they can be done by a place in Cambridge with a very quick turnaround time. Also, some of the, if you're identified as one of the Stop the Spread communities, where Governor Baker has set up clinics where anyone can be tested for free, no insurance, that's a government funded program, those results are coming back quickly as well. So unfortunately, none of those options are available to us, and the closest testing site for the majority of our testing is Beverly or Danvers, and it is problematic for us to get people down there sometimes who don't drive or have health issues. So it's something we've been working with our local healthcare providers. We've been partnering with the hospital and some private, looking at public-private partnerships. But at the end of the day, these large pharmacies will decide where and when and if they want to open a COVID clinic. The pharmacies are offering on-site testing, which is rapid, but it's extremely expensive. And right now that's being consumed mainly by colleges. So Quest and CVS have a lot of contracts with colleges. They're testing hundreds of kids at hundreds of thousands of dollars a year. They're setting up on site and they're just testing every day, which is obviously great, but you know, someone has to pay for that. It's not billed through insurance at this point. We're looking into some kind of piecemeal models here in the city. We have some ambulance companies, emergency companies who have gotten themselves certified to do this. And so we're looking at finding ways that we can partner with them to find someone to do the testing, someone to do the swabbing, and someone to do the billing, processing the whole thing. But it's complicated. And so that's where we're at with testing right now. I hope that answered your question. But the contact you mentioned that said an 8-day turnaround, that's not unusual right now. Mm-hmm.
Laura?
Thank you.
Laura?
Thank you. Thank you for all of this. I have many questions, but I'm going to ask two. My understanding is that children are often asymptomatic. At least that's what the early data seems to show, that they do get COVID, but they are often asymptomatic. So from a public health perspective, how do you manage asymptomatic children in a school building who may be infected without any sign of it, other than what you might see in the wastewater, although of course there are kids who choice in from elsewhere. So that's just one piece from a behavioral standpoint. We don't have the evidence of an infection, a child who goes to school. And secondly, and I'm referring to one of the teachers who spoke earlier, there are plenty of people from outside Gloucester who come into our schools to work, you know, as staff, bus drivers, there's lots of people, and there are students from outside Gloucester. So it sounds like, you know, you have an amazing handle on what's happening here, but of course we're not we're not living in a vacuum. And we have people going in and out of work, you know, all over the Commonwealth every day. So how do those factors play into keeping a close eye on our rates and keeping things under control here?
Great questions. Yes, children can be asymptomatic, so can adults. That's part of the really challenging thing about this virus, is that a lot of people are asymptomatic. And again, you can sort of stay in this period where 14 days where you're asymptomatic, but you could be carrying it. So again, the key is all the prevention measures we're talking about, you know, so keeping that distance apart, face coverings, they're going to be our most effective defense. And while the community transmission is low and the amount of virus in the community is low, those things should be sufficient. When we get to high levels of community transmission and it's just everywhere, then you have a different situation. But with asymptomatic kids and how you keep kids apart, I don't know. Some of the research lately is suggesting that they're not those sort of super carriers that we maybe thought they were. But again, the data is, and then a new study comes in and it's very, very hard to keep up, and there just isn't a lot of data right now. What we do know is that children are not getting sick and dying to the extent that older people do. None of us are, compared to that sort of 80 plus. Most of the severe illness and death occurs for people who are in the very higher 70, 80 plus with underlying medical complications. So, I don't know how much more to say there. When the virus is running rampant in the community, yeah, you're going to have more kids in your school with the virus, the asymptomatic. You're going to have more people everywhere with the virus. And it will get to a point which we can't all be together anymore. But at this point, we have very, very low numbers of people with the virus. And then your second question is, what if it's a staff from another town? Every lab reports to the state, so every result gets fed back to the doctor of the staff as well as to the health department in that community. Every health department has to have a Maven account and someone who monitors it daily. It's one of the requirements of local public health. It always has been, by the way. We monitor infectious disease all the time. This is what we do. Foodborne outbreaks, Lyme disease, TB. It's just now people are hearing more about this because of COVID affecting so many more people. But the public health nurse or team in the town in which the person lives will be reaching out to them, same process. If they don't have a CTC team like we do with as many nurses as we do, and we are really fortunate that we had, we were able to set that up and staff it. And a lot of towns don't have quite the numbers we do, but the state has a backup team. So every night at midnight, if the case hasn't been picked up, the EPIs at the state will pick it up. And, they might not be a local nurse, but they're going to be a qualified public health professional who will contact them and say, you've got a positive result, you need to immediately isolate. Anyone, in your household needs to quarantine for 14 days, and so on and so on.
Thank you.
Samantha?
Thank you again, Karen. This is super helpful. So I have a question specific to school transmission data. So my sense is that the data that we do have is observational from other countries that have done a better job of controlling spread, that we don't really have a lot of US country specific data about transmission in schools. So I'm sort of curious, do you know of any data that talks about transmission in schools while practicing all of the safety protocols? I know that there's certainly been outbreaks in schools that are not practicing the safety protocols that we're anticipating will be in place. But I'm curious if you could speak to some data in this country that might speak to low transmission data or not with all of the safety measures in place. And if there isn't that data, maybe just speak to that as well.
Yeah, I can't give you a whole lot more than what's the studies referenced in the DESI guidelines. They certainly, found what there is, and it points to, low transmission when it's controlled in a community. But when we have community-wide transmission at a very high level, you can't. It's very difficult to control the virus in any indoor setting. So. Thus, we saw the closings and the back last spring. I don't know within the U.S. if there has been. I mean, we haven't, as you said, we haven't done a great job in the U.S. of containing this thing. There's certainly pockets that have done better than others, and we haven't had. Massachusetts, I think, has been a leader, but we haven't had schools since we've put things in place. Again, what we know about transmission is it's when people are actively sneezing, coughing, runny nose, that kind of exposure. That's the bulk of the transmission indoors in close proximity. So if people are wearing face coverings and they're keeping that 6 feet apart, and they're not actively sneezing and whatnot, we don't have, it's not like it's just going to widely go like wildfire, through a classroom or a business. And we've seen that, we've seen it in the data, worldwide studies, and we've also seen it locally. We've seen case after case, every one of those 300 cases I mentioned in Gloucester have come through our tracing unit. Now, I haven't personally been involved in every one of them, but I know about a lot of them, and we see them, and we often, we mostly find that once our contact trace nurse gets done talking to the person, we realize there were signs and symptoms there. And that's when an outbreak happened in a business or somewhere else. So, it's so important that people know the symptoms and they follow the symptoms. And if they are actively symptomatic, that's the time in which they're going to be really contagious. And that's when spread is going to happen. To a much lesser degree, spread happens through touching of surfaces, through sharing pens or books. It's really, we think about like how you get a cold from someone. It's that real close contact with someone who's really actively producing and sneezing, coughing, those kinds of things. It's, again, not to say it can't happen, it does. I mean, we know asymptomatic transmission happens everywhere, but the bulk of the transition is going to be indoors, close proximity with a highly actively infectious person. And that's really all I can tell you. It's about minimizing that risk. I know.
Kathy?
Karen, thanks for being here tonight. My question has to do with knowing that there are a lot of summer camps and preschools that have opened, in the past month or two. And is there any data, or are you hearing anything about, problems with that, success with that? I'm just wondering, in your circles of talking with other communities, is anything happening that's not making the news, or is it not making the news because things seem to be going pretty well?
I think things are going well. I mean, we don't, here in Gloucester, we've had really very low numbers all summer. So we've had not more than 10 active cases at any one point in time. I don't think this summer, since our period, that sort of crunch where we're having 50 to 70 cases active a day. So yeah, those numbers are really low, and they're not children. I mean, we've had some teens, and again, they weren't following, generally speaking, not following the precautions of keeping 6 feet away, wearing a face covering. I mean, and teens tend to have a lot of contacts. They have a lot of social activity. So, when younger adults are index cases, it's a little harder to manage. But we have not had, I don't think we've had any children really, certainly this summer we haven't. So, the camps, the daycares are running really well. They're part of our reopening and our task force. We talk with them regularly, so we make sure that they have the training they need, that they have the PPE they need. And yeah, we haven't seen many cases this summer at all. And that could be both, it's mainly to do with the low community transmission in general. But, like I said, most of our cases in Gloucester were with very, very elderly people, often with underlying health conditions, and often living in a congregate setting where they're in a closed, enclosed quarters, and that's how the virus spreads. We have not seen any clusters in daycares or camps, knock on wood.
Thank you.
Yeah.
Samantha?
Just a clarifying question about that. So the daycares, though, arguably probably have less kids than they normally would, right?
Yeah.
We're certainly not at capacity. So it's hard to sort of understand if we were at capacity, what that would look like. And the camps, are mostly outdoors. So it feels to me like those two indicators might not be a true sort of sense of, the safety of having full capacity of all the kids and teachers and staff in schools. So I guess I'm just, as a clarification, if that is true, like,
Yeah.
Gloucester, mostly outdoors, right? It's not completely.
Yes, that's true. Most of the camps would be outdoors. However, there are a number of youth programs at Wise and arts and art classes, things like that, that are now up and running. We haven't had cases. Same thing with our adult population. I mean, businesses are all up and running. And yes, they are at that 40 to 60% capacity, depending on your business. And that's a good thing. That's going to keep us open. And it's a reality we've all had to live with. I mean, City Hall, we've had to spread out, you name it, your hairdresser. I mean, everyone is at that 40%.
Melissa, you had your hand up? Melissa?
Yeah, I do. I just wondered if we could still hear Karen.
Oh, did I lose you again?
No, you're back. You're back.
Okay. Yeah, sorry. So yeah, I mean, no, it's not a replica of the school. It's not the same environment, but you're going to have a reduced capacity as well by the spacing requirements that DESE has, and the, distance between people. So you'll have that protective factor as well.
Melissa?
Karen, thank you. So contrary to what a lot of people think, I mean, Massachusetts is open, Gloucester is open, businesses are functioning. I'm someone that goes to work the majority of the week, and that requirement is only getting higher by the week. I have to go in more days than before. So when I walk into the building, and when the public walks into the building, because where I work is very open to the public right now, we get temperature checks. A court officer checks the temperature right away, and if it's 100 or over, then you can't come in the building. And then when we go up, when we're in our work capacity, whether it be with our coworkers or dealing with the public, we have masks on. Masks are required. Do you see any other requirements other than masks and maybe temperature checks and the social distancing? Do you see any other potential requirements that should be put in place if we go back into a classroom? I mean, you have the space, whether it be 3 feet, 6 feet away, masks. Do you see anything else? And then what would you have, or what would you advise to teachers that if we do go back to the classroom, what they do, how they treat a child that cannot wear a mask, and what the extra protocols that can be put in place for those that have a disability wearing a mask and can't wear it, and yet they're going to be in the classroom with kids and teachers. So how can you advise us on those two topics?
Good questions. I'll do the mask one first, and then I'll see if I can remember your first one. Oh, your first one was other precautions with people all getting in together in close environments. The main thing is educating people on the signs and symptoms, and make it a game, make it a song, whatever you have to do. We've used some real life examples to try to kind of really show people how people come to work sick, or you go to a party sick. It just, you're done. It blows up everything. And this thing is, it's just a nasty little disease in that it really does affect a lot of people. So if someone in your house had COVID last winter, I don't know if anybody's experienced it, but it really does wreck your plans for quite a while, because it can turn. So, I had it, and then, maybe your husband would get it a week later, 2 weeks later, and then kids would get it. So it can go on and on and on. And we've seen that in houses, in businesses. Household contacts are the other most likely place that transmission occurs, because people are living close together, sharing things in a kitchen and bathrooms. And, that's just human nature. So, again, it's all about the signs and symptoms. The more you can teach people to not come to work sick, if you do notice someone sick, you should ask them to leave or go to the nurse or something. It might just be a runny nose or a cough, but you want to get that person, you want to, sort of have a low threshold for symptoms and ask people to isolate if they have them. Otherwise, it's all the basic precautions we do at flu time. So it's wash your hands, hand sanitizer, 20 seconds, really washing your hands, not sharing cups and other things kids might drink from, wearing the face coverings, wiping down surfaces at the end of the day as much as possible. All those good precautions we do at flu time, it's the same, they're the same largely for COVID, for any infectious disease, and we would want to just ramp those up and keep doing them. And keep that social distance as much as possible. If you have someone that can't wear a mask or won't, my advice is, you just try not to worry about that. If most of us wear a mask most of the time, we're gonna keep this thing at bay. There are a few people who cannot wear it for medical reasons. All you can do is ask, why are you not wearing it? If the child, and I'm sure you'll have some system with parents' permission for this, but in a business or a workplace, you can ask, why are you not wearing it? If they say a medical condition, that's the end of it. You can't ask them why. You can't grill them. You can't make them leave. You can offer some sort of reasonable accommodation. And you can make sure that they stay 6 feet away from everybody else. And they should be anyway, that 3 to 6 buffer. And that's all you can do. And that's what we do in supermarkets. That's what we do in restaurants. It happens every day. There are people who can't or won't wear a face covering. And it's the minority here. We don't have a lot of it. I know it's upsetting to people sometimes, but it's just the way it is. Not everyone can, and we have to respect that. And if most of us are wearing it, we'll be okay.
Are you saying the ADA will prevent you from asking for like a doctor's note that you can't wear a mask, that we just have to take the word of the parent, or we can't ask? Because the state is requiring that the kids wear masks. That's a requirement. So are you saying, in your opinion, that the schools can't ask a parent to confirm a medical reason for not wearing a mask?
I don't know what the rule is if DESE's come out with some special ruling for schools, but I know for the rest of the general population, the governor's orders for the face covering is that you may ask why they're not wearing it. If they say for a medical reason, you just say fine, and you offer to get their groceries for them, or try to make sure that they are not around other people. It's really all you can do. Now, if they're actively sick, sneezing, coughing, and they can't wear a face covering, then you have another issue, and you need to probably have that child go to a nurse's office or something else. But unless DESE has come up with some other ruling around this, and I think it's really all you can do. And again, I really encourage people to focus on the positive, focus on the people who are wearing them, and wear one yourself as much of the time as you can. If, there are studies that show that even, if 50% of the population wears it most of the time, you significantly drop the spread in your numbers. So the face covering is really, really important in slowing the transmission. It's really our best tool right now.
Thank you.
Laura?
Thank you. I just wanted to follow up on the distance issue because, of course, you're saying 6 feet, and generally we think 6 feet, but the DESE guidelines say 3 to 6 feet. And I haven't yet found where the 3 feet comes from. And as part of that, as a parent, I know that in addition to sneezing and coughing, kids scream a lot, and they, in delight, and they sing and they shout. And my understanding of this virus is that is another way that this spreads. And that's just a natural part of being a kid and, being in school. So just to, and that obviously it impacts distance and spread. So I'm just wondering if you can speak to that 3 feet issue and then these other ways of spread. Thank you.
Yeah, DESE, when they put their panel together of a lot of pediatricians, experts, and in their guidance, they refer to the studies in which they have referenced to make their decisions around 3 feet. And again, it's the best science we have at this point, but there isn't a lot of science. So I can't tell you for certain is 3 better than 6. I mean, staying home is better. Like locking yourself in your room is the best, but you know, we don't live in that world. We have low transmission. The risk is low. Kids need to be kids, and we try to do this safely. The feeling of the committee that the DESE panel put together, which was a lot of very well qualified people, was that the 3 feet was really safe for children, given that they are not these super transmitters that we thought. And you can see the studies. There aren't many, but they've referenced a few of them, and it is interesting. So, you know, what's the magic number? I don't know. I mean, we in public health, we're still go by the 6 feet for contact tracing. So it is a little bit contradictory. It's a little bit confusing. You know, as much space is better than none. And if they're going to be yelling, singing, being loud, if they can be outside, that's really good. You know, get them outside, because again, very, very little transmission happens outside ever. You are correct in that singing projects those air particles a lot. So any singing groups, I'm sure there's guidelines on that from DESE about choral groups and that kind of thing. But kids laugh and they yell, and that's what they do. So again, that face covering is going to prevent those sort of moisture droplets from transferring as quickly. And being outside is obviously the best thing, because the virus dissipates much more quickly in the outdoors than it does inside.
Thank you.
Samantha?
We have a lot to get to with the plan, but I'm just, while you're here, so something I've noticed, and I think this is just sort of a natural reaction to everything that we've been going through since March, is that there's definitely sort of virus fatigue, and people are kind of loosening up on their social distancing, especially being the summer. Lots of kids are getting together, lots of families are getting together. So I'm wondering if you could just sort of speak to what you see this community and what families need to do to have sort of the best case scenario of sort of in-person education, right? So once things start to cool off and people are going inside more, even if we have low transmission numbers here, is your recommendation that people kind of dial it back and start to socially distance again outside of school and not get together with lots of family members or lots of other kids? I think that people might need to fully understand what's their part in this process, so that we can actually be in school if it is safe to do so. Because if the community is not doing their part, parents aren't doing their part, then this is all for naught. So if you wouldn't mind just sort of talking about once the fall comes, what you think parents need to do to maintain safety, I think that would be super helpful, because we have a lot of people on the call, and I think that's just something that I would like to hear more about.
Yeah, I mean, that's a great point you brought up, Samantha. And the World Health Organization, that's criteria 6 for being safe to reopen after a pandemic, is that the community is all involved. It's a community-wide level, and these sort of 5 core things, prevention measures, most of which we've talked about tonight, are happening at a community-wide level. And in particular, our highest risk areas for transmission. So that would be any crowded housing, that would be senior housing, long-term care facilities. You have to have those things under control if you want to safely reopen. So it's absolutely a community response. But, you know, we've seen the community reopen business after business this summer in a limited, weird way, in a little bit different, all with face coverings. And we've seen people do it, and we've seen very little transmission happen. So these are really positive signs. Yes, as we move into the fall, we're going to have to be more careful as we go inside, as larger, you know, schools and colleges open. We're going to have to be more careful. With colleges, we also have the movement of a lot of people throughout the country coming back to colleges, and we don't know what that will look like yet either. So, Yeah, I mean, the more we can do as a community to all those measures, 6 feet, stay home as much as, avoid crowded situations, don't have parties, wear a face covering. If you go out to eat, keep that 6 feet distance. So all those things that we're constantly reminded of, if they happen throughout the community, it's going to keep that spread low. And I feel like it has in Gloucester. We've had very low transmission all summer, and we have a lot of people come to Gloucester, as you've seen. We have crowded beaches, we have popular restaurants and tourist activities, we have kids and families out of school and work. So there's been a lot of people around, a lot of businesses reopen, and have done so really safely. But we do know that as fall comes up and flu cases rise, because that's the other thing that will affect, one of our reopening criteria is the ability of the healthcare system to cope. And if flu hits on top of a bad COVID season, we'll be at capacity, and that's a game changer for us. So we're really worried about flu. It largely affects the same high-risk populations as well. But the good thing is, the one good thing here is that the prevention measures for flu are the same as COVID. So we're just going to be hammering, as the state is, all these messages about flu prevention, which is also COVID. And there's some thought that we might have a better flu season this year because people are wearing face coverings most of the time. That's going to prevent flu as well. People are thinking about washing their hands when they come in from the grocery store or places a bit more. They're sanitizing their hands on their way in and out of a grocery store. So if we continue to do all of those things that we know slows the transmission of both, that will help us ride out the wave of cases in our community. And I don't think anyone expects there'll be zero. We're not going to hit herd immunity or a vaccine situation for a while. That's a ways down the track. But what we hope for is this keeping it at a very low, safe level that we can continue to, at some capacity, operate and stay functional. I mean, that's the goal. But it will become more challenging when we all move inside. Absolutely.
Melissa?
I'm thinking this will be my last question, but I could ask you questions all night. So I want to ask you a little bit about the social emotional piece from the Board of Health perspective. I know for a fact domestic violence cases are on the rise. And I can say wholeheartedly that a lot of cases involving children, and there's a lot of children victimization right now going on within the city of Gloucester because of all that's going on in the world and all the challenges. Does the Board of Health track any of that information? Are they involved, stay informed in it? And what do you offer us as a committee? Any words of your expertise about how important the social emotional piece is by going back to class as opposed to staying home? Because that's something that a lot of people don't want to either admit or talk about or even realize that's going on with this disease. And it's a fact and it's real. And I also have a very special little girl in my life that seems to have a lot of severe ability to relate to people now and is afraid to approach people because there's so much fear of being in lockdown. So that in itself is creating problems with kids. So how can you advise the committee or help us in making this decision whether to go back or not when it relates to the social emotional piece with the kids? I don't know if that's I don't know if I worded that right.
I'm happy to take that one. I mean, I think that's the crux of the issue, and I appreciate you bringing it up. It's something that we've struggled with as a board and as public health professionals from day one. There are enormous public health costs to poverty. There are enormous public health costs to social isolation for not only our higher risk population of seniors, but for our young people. And, as much as we've talked about studies around the safety and the amount of transmission, there are a lot of studies and projections around things like teen dropout rates. We've seen the numbers locally of children who were not engaged in school at all or to a very low level last spring. No community was exempt from that. It didn't sort of matter what zip code you were. We know that the low income zip codes, those kids will be affected the worst. And this is the other terrible part of this whole thing. But from a public health point of view, it is absolutely a terrible, terrible choices we've been faced with this year. People personally, and as you said, poverty leads to domestic violence. It leads to food insecurity. It leads to homelessness. And the list goes on. Substance abuse, anxiety, depression. We are very concerned, and we feel that we don't even know what the long-term effect of this will be. No one does. We're not out of it yet. These are the incredible challenges that face us as parents. I have two kids in school, in high school and college, and the community, and you as a school committee. It's about that risk, and they're full of risks. And as Ben mentioned at the beginning of the call, there are risks when you drive your car. There are risks when you get up in the morning. It's about managing the risk. It's about minimizing the risk. It's about understanding the risk. And whatever happens with COVID, I feel that we'll have some more bumps. We're going to have some rough spots. I think we're going to continue to see financial instability in our community, businesses not being able to rebound, people with job loss. We see those numbers. They're not going down, and no one projects that they will. So all of those other issues are going to be very real for a while. So our challenge as a community, and it's not just on the schools, it's all of us, and we say this on our Thursday calls, we have to figure out how to support our families through this and how to support them returning to school or finding purpose or learning or whatever it is. But it's a huge challenge, and that's what we're up against. So yeah, I appreciate you bringing up the issue, and that's what we do in public health. It's just constantly weighing these risks, and that's why I said in the beginning, we'll be watching it really closely.
I'm just worried that teachers are mandated reporters, and a lot of calls that go to DCF or courts or police come from teachers as the first indicator of something going wrong in the home. So I'm just wondering how well that's going to work through Zoom. So that's why I can't sleep at night over this issue.
Yeah. And the numbers have decreased, the reported numbers of child abuse have decreased significantly, and there is significant concern. That's because there's no eyes on these kids. So the schools are such an important part of our communities. And I think that this whole thing has highlighted that schools are so integral. And I encourage you to ask your partners in the community for help in any way we can. It's going to take a lot of support to you guys to keep this all moving along in the right direction. But I think everybody wants that same goal, to have you safely be open or supporting our kids in whatever ways, because it's probably going to look different. We might do some online, we might do some hybrid, we might do, but yeah.
Joel?
Thank you. And my apologies if I'm asking a question that was covered. I missed about 5 minutes of the presentation, shifting to one computer that would work. But my question is, Ms. Carroll, are we talking about, you just said, we're not going to be in a herd immunity position. We're not going to be in a vaccine position from at least the rest of 2020. And so are we talking about if we reopen and send staff and students back into the schools, is this, eventually going to overtake us no matter how good a job we do? Or if, there's a lot of seemingly when, but not if, in the way you're presenting. So, when transmission starts running rampant, we'll have to close down. Is there a path where if everyone, does what they're supposed to be doing at school and everyone is doing what they're supposed to be doing at home, that we don't hit that point where we have to back down? Or is it just going to delay when we eventually have to back down from being in person?
That's a tough question. I mean, I don't know. I'm an optimist, so I really think if people keep doing the right thing, then we can maintain some level of keeping our society open and moving along. I don't know, I don't have a crystal ball. Certainly some of the challenges of this around testing that haven't been met, that's not helping us. And it's a real concern on my end. But, I think if there is a lot of evidence, and there are countries that have been able to stay open and keep this suppressed enough to go about business in a maybe slightly modified way or restricted way, but to continue to operate through this. And, that's what we don't know. But I feel like if any community can, Gloucester can. It's been so, it's just come together. It's worked hard to make sure that, and largely people are in compliance and supporting each other and following the rules. And our data has largely reflected that. So I don't, it's not inevitable. We definitely know that with face coverings and prevention measures, we can slow the transmission down. There's enough studies that do show that. And it's just, how it will all play out. And I don't have the answer for that. It's hard to say. In terms of vaccine, that is the bad news. The vaccine will be a little while, and then it will come to the highest risk people first. So I don't know whether schools, hopefully schools and school communities will get it early on, but it may likely to go to older people who are hit harder by the disease first. So like with any vaccine, it's kind of like a rollout that we'll have to be a little patient with. And then having the infrastructure, we don't have a public health infrastructure to do mass vaccination, so it takes time. Hopefully the state will help us, but they're learning too. I think the good news is that our treatments are improving and our ability to understand and learn from how we care for patients. So that's improving, and medicine's quite good at that. So over time, it learns from itself. It learns from how it treated the first few patients. And so I think that there'll be hopefully some better treatments, some better therapies, and certainly some better understanding of the early symptoms and how to identify them and act fast. So those are all things on our side.
Thank you very much. I'm thinking that we should move on. It's 8:40, and we still got a long ways to go. If you have more questions for Karen Carroll, if you can submit them in writing to the superintendent, and he will relay them on, and we'll get answers, and if necessary, we'll have to ask you back. But
that's fine. Happy to come and talk with you. Yep.
But I would like to try to get to the rest of the presentation tonight. So Ben, and thank you again. It's been a world of knowledge, and we really appreciate it, and thank you very much.
You're welcome. Good luck.
Aaron, if you could just hang on for a minute, I'm going to show a slide that I want to make sure that you and I have talked about these things, but I just want to make sure that it resonates with you. And before that, and then you can slip silently away and go do other things with your evening. But thank you very much. You've been a great help, part of our community stakeholders meeting, obviously working with me and our team, coming to talk to their principals and our leadership team. It's just been really helpful. So thank you. And obviously tonight as well. So folks, we do have quite a ways to go here, but let me start, let me put up the presentation again while Karen's here. What this really is focusing on is just what we've been taking and working on Karen with, it was just and what she has said, and just want to reiterate that for us, working with the Department of Public Health, community transmission is the key metric.
Ben,
Ben, that's kind of, your share is not working. We're not seeing the.
What are you seeing?
Seeing a white line with a blue square in it.
That's not good. Hold on, let me try this again. 1 second. How about that?
That works.
Much better.
Okay, good. All right, okay. So let me back up. So just that, as Karen has said, community transmission is the key metric. And what we're trying to do with the schools is making a plan for Gloucester based on what is happening in Gloucester. And as Karen has said, the community is doing a very, very good job in Gloucester. We aren't Florida, we aren't Texas. And so what we're trying to do is base our planning and base our decision-making on what's happening here. And as you said, and as Karen has said, I mean, Gloucester Health Department is doing a fantastic job in actually developing new methods to understand community transmission. And so we will look at that very, very closely. We'll continue to work with her on a daily and weekly basis, especially as we open school. And so as community transmission remains very, very low right now, we are prioritizing planning for as much in-person learning as possible. And that's what we'll work on tonight and continue to work on and talk to you about tonight really is what does that mean? What can as much in-person learning as possible mean, considering our building, considering our staffing, considering the safety guidelines. And then also for everyone to know on the call that at the same time, we're also preparing to move to remote learning or a combination of remote and in-person learning as the situation warrants. And as if things change, I'm with Joel and hopeful in that. And since, can we, can Gloucester avoid that by continuing to do the great work we've been doing? So, Carol, is that making sense? What I'm putting out there?
Mm-hmm. Yep.
Great.
Yep,
Right.
definitely.
And our team is really basing, this is sort of our bedrock here about how we're thinking about just the connection between community transmission and planning for, getting back to school. So we'll move on here to looking at the planning and the plans and that sort of thing. Plans are taking shape. These are preliminary plans in the sense that they're not final yet because we need more input from families and staff, and also the school committee needs to deliberate. As we said, parent forums are scheduled. We submitted these plans, a version of them last Friday, and then of course moving forward from there. Well, we're required to develop our three approaches really in one plan: in-person learning, the remote learning, and also some of each, which is the hybrid model. We'll describe tonight how we are strengthening the remote learning, and I'll give you some details on that. It must be much more structured and constitute a full day, unlike in the spring. We also are prioritizing our high needs learners. That's a value of ours, but it's also an expectation from the Department of Education. And we'll describe tonight as well how we're prioritizing their in-person learning as best we can. So this is just, our planning is based, I said, on the DESE guidance that they're putting out regularly and also putting out recently. And you'll see here that there's protocols on COVID-19 scenarios. We won't talk too much about those, but those are specific approaches to what happens if a student or a staff member have symptoms or test positive. What I didn't add here, but came out on July 9th, was guidance on supporting special education students and high needs students. You see there's facilities, transportation, remote learning, and also length of school year and instructional hours guidance. All coming out fast and furious, and we're all incorporating that into our planning. Our final plan is due, or really our plans, our full plans or complete plans are due August 14th, a week from this Friday. The Department of Education has granted many districts, including ours, an extension from the 10th, based on the need for a school committee to have an additional meeting or two, which is what you all have planned for next week. Just quickly for the public to know, the committee may know this, but to reiterate and make sure the public can know, is that DESE is prioritizing in-person learning because of the myriad negative impacts we've talked about of children when children are not in school. They are saying that we should have a 170-day school year instead of 180 days, and about 5 hours of learning time per day. So those are both adjustments because of the pandemic. And that's going to be 10 days. Those 10 days reduction in student days or an increase in 10 days of planning preparation for our teachers and staff. Those will happen in the beginning of, right in the beginning of the school year, and really delay the opening of school. We'll talk about that calendar tonight as well. To talk about physical distancing as a guideline is a minimum of 3 feet with masks and other safety requirements, and then going up to 6 feet. All students in grades 2 through 12 are required to wear masks, with a few exceptions. And then students in preschool through 1 are encouraged to wear a mask. We will very much encourage those students to wear masks and their families to support them in wearing masks, just because we know that's still, as you heard Karen talk about a lot tonight, that's the safest way to operate. Okay. And then all distancing and mask wearing rules will also apply in buses and vans. And we've gotten very clear guidance and communication examples from DESE on that. And our new transportation director, Adam Mayo, has been working on that and putting together plans for that in that area. These are the guidelines on key health and safety measures in terms of that we'll have to be doing in our schools every day. And as Karen Carroll said, sticking to these gives us our best chance for success. So that's masks and face coverings, physical distance, as I already mentioned, 3 feet as a minimum, and then as much as 6 feet, we'll be doing all of that. Hand washing and hand sanitizing. We'll talk tonight. We are putting hand sanitizing stations in all classrooms and common areas. And then really, really important, folks staying home when they have any sort of symptoms, and that is staff and educators and students. And that's going to take a lot of education. The whole community's been doing that, but we will continue with that. Our teachers and staff will reiterate that. The school committee should reiterate that. All of us in the whole community should reiterate the concept, whether it's work or school or anything else. Folks need to really stay home when they have any symptoms. So our planning has really been the combination of 4 primary groups that have been working in stages and in different levels of engagement. The remote learning working group started in May. That's teachers at each grade level. I'll show you who's on these teams. Our district-wide reopening team is a cross-role, cross-functional team of folks from all schools and many, many different roles. They're providing feedback on the plans as we develop them. They've really been in sort of grade level groups, so elementary, middle, and also high school, and giving and really shaping a lot of the thinking that we've been doing across the board. A community stakeholders group. Folks were talking tonight about just, getting other partners in across the city to help out. And this stakeholders group, you'll see the membership in a moment, is a tremendously committed, engaged, and powerful group that's been doing tremendous work. All these folks have been doing great work for Gloucester for many years, and they really want to help out as well. So we're engaging them. And then our leadership team, and you'll see those folks. This is the team that's taking all of this input from faculty, from staff, and staff meetings, from these 3 groups, and connecting it all and combining it all. These folks are, it's not possible to make a plan, to draft a plan and write a plan with 100 people. It just can't be done. It needs to have a smaller working group. That's our leadership team, principals, key district leaders. They're taking so much input from so many different areas and fashioning it into what you see tonight. And then showing that to people and getting feedback. So it's been a very iterative process with all these groups. So I'm going to run through these quickly, but then the point of showing you all these folks is just to see the number, but also to see the range of folks who are involved. So speech and language folks, teachers, this is the pre-K advisory committee for remote learning. Folks have been working since May on how do we strengthen our remote learning approaches from the spring. Every district and community across the Commonwealth realized, and Gloucester did too, that we could do better than we had to do in the spring when we just sort of were just transitioning immediately, with no planning time. And these folks, these are the K-5 group. Again, you can see across all schools, many folks, different types of roles, reading coach, special education, all different grades, our EL coordinator, just a great group of folks, again, working since May. 6 to 8, the same situation from across the school in so many different fields and subject areas. 9 to 12 as well. Another, dozen or more folks working tirelessly throughout the summer to strengthen their approach to remote learning. Here you have the district-wide reopening team. Sorry, this is actually 2 groups of folks, meaning there's 2 columns of people here. But again, you'll see our special education director, paraprofessionals, teachers, principals, art teachers, social workers, librarians, psychologists, just a tremendously diverse group of folks who keep showing up every week. I expect attendance to be down at some point, but the whole group shows up every week to give us input, to shape the plans, to give incredible guidance, and that has really made a difference in our planning. Last week, they were working on and giving us really good ideas on what we should do for those first 10 days when we're working with our staff to prepare. and train them for the opening of school. The group goes on here. Here's the last few members of the team: nurse, principal, and then this is the community-wide stakeholders group. Sorry, my light's going off. Sorry. It's lonely here at 2 Blackburn, and the lights go off on occasionally. So this is just a great way of seeing this tremendous group of parent representatives from our school site councils, city departments. Mike Hale from DPW and Karen Carroll are on this. Great community partners from the library, Children's Friends, Wellspring, GEF Pathways, just so many folks. And then represented from our central office team, and then students. We're actually naming three high school students who are real leaders at the high school, and they're going to join the group as well. And then finally, our leadership team here of principals and district leaders who are involved, who know so much. These folks are also great educators, and really they're the ones who are piecing all that input from all those people I just showed you together. So I just want to, the point of this again is for everyone to realize that this is an incredible collaborative effort from across the district or across the community. We're getting a lot of good information, good advice, good counsel, good suggestions, and trying to organize all that into coherent plans. So just quickly, what have we been doing? Developing 3 approaches simultaneously. I mentioned to the community leaders group last week that those 4 words, developing 3 approaches simultaneously, don't really capture all the work that goes into that with folks working every week, every day on this. We've been stress testing our schools to understand how we can do physical distancing. We've been moving desks around and configurations, determining whether students can fit safely. We've been ordering thousands and thousands of pieces of PPE. We're installing dispensers for sanitizers. We have lots, literally thousands, tens of thousands of pieces of PPE already on site. And we're identifying additional staff that may be needed. We'll talk about that. We're identifying resources that are needed. I'll have a slide on that. And we're also reviewing our buildings for airflow and exchange. We'll get into that a little bit. And then acquiring technology for all students grades 3 through 12. So just a lot of work. Those are just the highlights of the work we've been doing. And all this work goes into plans we'll share tonight. I do want to talk about data again, and this is the family and staff surveys. So as you know, we surveyed families and staff from July 22nd actually through July 29th to the 31st. We translated our surveys into Portuguese and Spanish. We asked families about learning models, transportation, food services, and other matters. We asked our staff about learning models, flexibility in roles, and also childcare, and also professional development. Great response rate. More than 2,100 parents responded, or families responded, about 2,100 students. And also our staff, just a very high response rate of staff as well, with over 300 responses. So just to summarize, our families at this point strongly support having students back in school at least part of the time. If you combine the 39% of parents preferring an all in-person learning and the 41% of parents preferring a hybrid approach, we have 80% of parents prefer some version of in-person learning. And that's one of the reasons we are planning the way we are. We'll talk about that. Only 30% of parents responding support all remote learning, so not having their kids in at all if the physical distancing guidelines are met. So even with us taking care of the safety precautions, at that point, 30% of parents support all remote learning. And then 20% of families say that they only want to do remote learning no matter what we do. And very importantly, because we're looking at different hybrid approaches, we could do a week on, week off, or we could alternate days of the week, within a week. And an overwhelming number, 73% of families prefer having students in school 2 days every week, so alternating days, rather than having students in for 4 or 5 days and then off for a whole week. So that has really affected our planning. These are just the graphs. I won't go through, those are the highlights. That's what these graphs represent. They're also on our Get Back Together GPS website. And we've shared them with families and staff as well, and of course with the school committee also. I do want to get to I do want to actually focus on this one first on the left side of the screen. What we really want to acknowledge, and I want just to take a moment to talk about, is we really understand that families, yourselves, staff have concerns. I mean, this is difficult situation. And we're trying to plan with the empathy for folks and also plan based on what's happening here in Gloucester. But we really have to acknowledge that, you know, everyone has concerns on some level. And for some folks, it's really, really difficult to see a way forward on this. And that makes a lot of sense. And that's why we're trying to, with safety precautions and good planning and good thinking and decision making, trying to minimize those risks. So then going on to staff surveys, we asked questions about, as I mentioned, a variety of areas. At this point, 66% of staff preferred some type of in-person learning, with 25% preferring all in-person learning. This is of our staff, so all those people responded, and 41% selecting a hybrid approach. So our staff certainly see from this survey the value, the need, the importance of having in-person learning in some way, shape, or form, and we're certainly taking that into account. 51% of our staff prefer the A-B alternating day version, so within the week of the hybrid approach, and 24% say they had no preference. So that's a much higher percentage than those selecting or preferring a week-on, week-off model. So you'll see that we do not suggest doing week-on, week-off model at all. And then the last piece is just looking quickly at the use of technology. And we have 58% of our staff saying they are extremely or quite confident on using Google Meet, which is our primary platform. And then another 21% reporting being somewhat confident. Part of the work of those grade level remote learning teams that I showed you earlier is figuring out just what training can our staff need to develop confidence and efficacy using technology. And we have been doing some of that, and we'll continue to do more as the summer progresses to make sure that our folks are confident with this sort of work. And again, this is just the graphs to showing. Here's this just the basic numbers or the graphical representation on staff responses on whether you would go back for whether you prefer in-person, remote, or hybrid. And you can see how it breaks out with 41% preferring hybrid, 26% doing all in person, and then 32% doing all remote. So very important numbers to pay attention to and to listen to. This is about the hybrid learning, and then this is about the technology, just to show you those graphs. And the complete results, each survey had about 10 or so questions are up on the Back Together GPS website. So let's get into the meat. Let me stop there, see if there are any questions before we go any further, and get into the meat of the presentation, which is the learning models. Okay, I can't see everyone's picture. So.
I can't see everybody, so just speak up if you want to ask a question.
Doesn't look like there are any questions, I don't think. Okay, so I'll keep going. So on our learning models, we'll look at all five, all four areas, plus we'll talk about Remote Learning Academy. So this is going to be a lot of information, folks, so hang in there. I'll stop after every grade span. So first, we're going to begin with the health and safety elements that we're going to be focusing on and introducing and training on and practicing. And really, as Karen Carroll said, we stick with these. We're gonna be in the best shape possible. Our student cohorts will be as small as possible, so we can minimize how many students each person's in contact with. Desks will face the same direction and be distanced at least 3, and in most cases more than 3 feet apart, upwards of 6 feet. We'll try to minimize the amount of staff that are working with large groups of students or with many students, and so we'll do push interventions, and service delivery will be prioritized. As I mentioned, hand sanitizing stations, we'll have those in every classroom. Snacks and food have got to be eaten without masks, and at that point they've got to be 6 feet apart. As I'll say later, that's actually causing us quite a bit of challenge in our schools in terms of serving lunch. We'll have scheduled hand washing and hand sanitizing, as I mentioned about masks before being required for grades 2 through 12. And then we'll be adding hygiene signage and also distancing signage and sort of, traveling signage in our building. So we'll have a real defined path of which directions folks should go One of the best things that's happened, I think, with COVID-19 is how Market Basket and the big supermarkets have, one-way aisles. I've liked that a lot. I hope they keep up with that. But we'll have one-way directions in our schools as well to make sure folks are following a good traffic flow. I mentioned before about students and staff will be expected to stay home if they are sick. We are going to really, really push that so families know it, staff knows it, students know it. Staff will receive required training on personal and work safety conditions. Staff will have masks and face shields. We'll be supplying those. They can supply their own face masks. We'll supply face shields. We'll be limiting our visitors to essential personnel. We're going to take out extraneous furniture, soft seating, that sort of stuff, anything, those sorts of surfaces. And that's partly to just improve, safety, but also to make sure we have space for our desks and chairs and that sort of thing in our classrooms. And we'll, whenever possible, we'll be making sure we are increasing our fresh air in our buildings through opening windows and other means, which we'll talk about more too. Our feasibility testing in terms of space and what we can fit in our schools has been very, very helpful. We've been stress testing our buildings, guided by the Department of Ed, looking about how we can space out students, what happens when students eat, that sort of thing. Our classroom space and building space, is presenting challenges, which we'll talk about tonight based on the models. Our full in-person learning with a regular school day is very, very difficult. And we'll talk about that more as we get into the models. And that's why we are prioritizing some, our hybrid approaches. We'll talk through all the other ones, but we're prioritizing those in a variety of forms. And we're aiming towards the hybrid models and getting kids in school 4 or 5 days a week as best we can. And we're hoping to do that, especially as community transmission is low right now, and we hope it continues to be low. If we can get our students into school at the beginning of the year safely, as many days as possible in the first 2 weeks, 3 weeks, a month, maybe more, but that can really set a foundation for the relationships, for the teaching, for the instruction that we will need if and when we go to a full remote. So if we can, we are really trying to get our students in safely in the beginning of the year, even if it's for a short time, if we can do it safely. If we have to pull back, that's okay. Because we do know that setting our kids up for success through in-person learning, through setting up routines, through getting to know them, will help students regardless of what model we are in for the rest of the year. Here's a quick overview and summary. So you see the 3 approaches: full in-person, full school day, hybrid, and full remote. As I said, we will not be discussing at length the full in-person, full school day for K-5, for elementary, middle, or Gloucester High tonight. We'll talk about it a little bit. But we will talk more in depth about the full in-person for preschool, because we feel like we can do that, and we'll talk about that. For hybrid, the green means it's the preferred approach, and I'll explain all those in a little bit. And then full remote, the check marks mean that we can do it, we're planning for it, we're prepared, we will be prepared to do it. But at this point, not our preferred approach. Hybrid, as I'll talk about, doesn't seem to really be feasible for our youngest kids, our preschool learners, and I'll talk about why that is in a moment. So let's move on to Gloucester, our preschool. We are working on the in-person approach. The smaller class sizes make this possible in our building here. We will be limiting it to 11 students. 11 students allows us to continue the integrated program that we have with special education students and general education students. So that's and we'll be able to provide in-class lunches and at the same time comply with the 6 foot of physical distancing that needs to happen during lunch. To offer a significant amount of in-person learning at preschool, we're looking at adjusting the schedule. So currently we offer half-day sessions in the morning and afternoon. We are considering moving that to those half-day sessions to full-day sessions 2 days a week. So it would be a very comparable amount of in-person student learning with their teachers, but it would happen on 2 days of the week instead of 4. We are working on that. We'd love to get feedback on that. One of the challenges here is if we have the double sessions like we typically do, a morning group And then in the same room, an afternoon group, we were concerned about the extensive cleaning that would likely be necessary between those two, and whether that means we can pull it off or not. We do understand that's potentially going down from 4 half days to for a family to 2 more complete days. All special educations then we also have full day special education classrooms, and those would maintain their current schedule. There wouldn't be a change under this model. The hybrid learning at the preschool we think is inappropriate. And what we would do is if we need to go to a hybrid, or we can't have kids in the buildings, we would go to a full remote and essentially skip over the hybrid learning in this. It isn't really appropriate to do a combination in school, and then time doesn't work out very well in terms of doing some in school and then some remote with our youngest students. Which brings us to the full remote learning at preschool. The preschool would provide remote learning lessons, live learning activities, and related therapies if we went to full remote. The school administrators work very closely with families to make sure they have the technical support and were able to access all learning support. They'd be meeting with them regularly to make sure they knew how to support their children in this type of learning, which would both be led by teachers and organized by teachers, but also would need significant support from families as well. The preschool would prioritize translating documents and interpretation for our English language learner families. And they would very much follow detailed weekly lesson plans that families would know about, would have, and families would be able to follow. Attendance would matter, as it would in all our remote learning approaches. And they would provide ongoing support via telephone and email with their families. So let me pause there. See if there are any questions about preschool before going on to elementary school. Doesn't look like it. And just the key thing there for the in-person is that we would make our classes, instead of 15 or 16 students, would go down to 11. So let's look at elementary school's plans here. This is what I'll show you tonight, all in-person. We'll show you 2 different hybrid approaches. One is an in-person plus one. That means in-person plus remote. We'll show you a hybrid, 50% of students in on any given day, and then we'll show you a fully remote approach. Well, I'll also mention the Remote Learning Academy as well, which is for those families who opt not to have any in-person learning, which we'll offer to folks. So the return to full in-person learning is very complicated at all of our schools, including our elementary schools. And really the sort of the sticking point here is providing lunch, honestly. The most difficult thing that not only our school, but schools across the Commonwealth, across the North Shore and across the Commonwealth are really struggling with is when you have students 6 feet apart, our facilities actually don't lend themselves to doing that when kids having the space, having the staff to supervise and actually pull off lunch in a way that meets the health and safety requirements. So we aren't suggesting this. And also for the full day as well, we think that would cause significant sort of just exhaustion for kids in terms of having to pay attention, be fully on board with all the health and safety guidance, wearing masks. It would be pretty exhausting for our youngest learners to have a full day under those conditions. So instead, we're looking at hybrid models. This is a 50% hybrid model. That means that students would go to school. So you have cohort A, about half the students in a school would go to school on Monday and Thursday. And then another half of the school would go to school on Tuesdays and Fridays. And then we'd have 1 day per week that would be remote for all students except for high needs students. High needs students would be in school, in our elementary schools under this model all days. And so what this model would allow is a full day of school, because with half the kids in school, we could serve lunch safely, but it only provides about 12 hours of in-person instruction per week. Kids are only in person two days per week. It's a full day, but only 2 days. Our average class size would be small, 8 to 12 students. That would allow us to do 6 feet of distancing in our classrooms, go up to 6 feet of distancing. It also, and then English language students and high needs students would be in 4 or 5 days per week. This is based just a really graphic representation, basic graphic representation about how it would go. You see that the green is when folks are in school. You have cohort A schedule for the week across here. And then you have cohort B's across here as well. Actually, well, we've been also adjusting this potential. So you have the remote day rather than Friday, have it Wednesday. And that would actually mean that kids would be, with their teachers in the most regular pattern. This is what we're calling the in-person +1 remote sort of hybrid model. In-person +1 hybrid model. It's preferred model, and I'll explain why. At this point, in terms of our planning and where we are in terms of our thinking, this would allow all K-5 students to return to school every day for 4 hours per day. We'd have to shift start times a little bit later in each schools, and you can see those there. This would allow every day for students to work with their teachers, interact with their peers, allowing them to both maintain academic learning, but also really keep up regular social relations. In this case, the distancing would be maintained in accordance with state guidelines. It'd be between 3 and 6 feet, and we'd ensure all the safety guidelines we've been talking about. Students would complete the day out of school with an additional 45 to 60 minutes of remote learning time at home. The nice thing about the remote learning in this case, unlike prior to this, is that students would have very clear guidance that they went over in school with their teachers about what to be doing during the remote learning time. And the remote learning time would be reduced to very little, no more than 60 minutes per day across the week. In this case, the students would be in school all 5 days. It would allow at least 20 hours of in-person instruction for general education students, and those students with high needs would get 30 hours of in-person instruction. So quite a bit of difference in terms of in-person instruction over the 50% AB model. We would address the lunch issue by having grab-and-go breakfast and lunch kids would get as they're leaving, and that would be for all students who need that food support. We'll be able to get that and to eat at home, take with them, and that sort of thing, and doing that prior to the remote learning block in the afternoon.
Can I ask a question really quickly?
Sure, yeah.
Just to clarify.
Go ahead, Bill.
Thank you. Just to clarify, in this preferred model, the individual class size would remain the same. So the low 20s that classes typically have, the physical size of the classrooms are large enough to accommodate the distance requirements and still have 22 students in these rooms?
Yeah, a couple of things. Yes, that's a lot of the work we've been doing is testing that out in all our elementary schools. A couple of things on that is, so as you know, rightfully so, a lot of our schools have gone to tables of late. They'd have to remove those tables, and because we expect the high school to be on a hybrid model, where they'd only need half their desks between that and desks that are already happening, we already have elementary, that would allow us to provide the necessary furniture to make that space in our elementary schools and not have to buy a lot of desks. So, but yes, with that, with the space.
And that includes the older buildings where we hear frequently that, one of the deficiencies we often get cited on is that our elementary school classrooms are too small for MSBA regulations for a modern classroom. But even the old classrooms that are, quote, too small are still big enough to have the desks brought in and keep the students.
There's also one other thing that likely will help us. And that's, we do expect, it's hard to know at this point, but somewhere around 20% of students perhaps to opt out and go remote learning. So that also helps us as well. But yeah, so that's we can stick within the 3 to 6 feet, or 3 to 6 feet and more on these. It varies by classroom, but the principals have done a great job, literally like going classroom by classroom and testing this out. And we'll be able to do that in those classrooms. I'll show you pictures later about O'Malley. I don't have pictures right now of the elementary schools, but we'll show those to you next week in terms of what those classrooms look like. This is hold on one second. Sorry about that. This is just to show you the morning block of students, the green meaning they're in school this whole time. Then the afternoon block is remote, but for high needs EL learners and those EL learners who are high needs, they would continue in school for the afternoon block. So some of the advantages about this, it's prioritizing quality over quantity. So we are reducing the in-person learning time with this model by about 45 minutes to an hour, because lunch often would usually take up some of that time as well. We are developing, a regular school learning environment is preferred, I think, by most folks over a, out of school learning. This also allows teachers to have time at the end of the day during that remote time, and also to post online material, to plan with grade level counterparts, so they have time built in to do the necessary work to support their teaching and support their students. It also allows us additional time for cleaning and disinfecting each day as well, every afternoon. That's just to give you a sample schedule. Oh, I've gone over mostly pros and cons already in terms of the preferred approach here. So we don't have to stay on here too long. I'm happy to take, let me just talk about a few more things and take more questions. Specials, art and music and PE. We will be trying to prioritize outdoor classes wherever possible. This includes PE, obviously. Music, we are not able to do singing and wind instruments because they disperse clouds of germs. No after school band. We will prioritize music appreciation and other elements of musical production in those classes. And then art can go on as normal, but we will have to supply individual materials for students to use because there can't be any sharing of materials. And then the last piece here is just the remote learning. So if we are, if we do need to go to full remote learning and have no students in our buildings, we were going to strengthen them quite a bit. And I'll just highlight a few things. Unlike in the spring, students in classes would follow a daily and weekly schedule, just like they do when students are in schools. Attendance would matter. Work would be, assessed in the way it typically is when our kids are in school. This would include live daily morning meetings, check-ins for students, work to maintain social connections and motivation, and that happens in those daily check-ins and those morning meetings. It would be a combination of asynchronous and synchronous teaching, small group support, and also support for those students who need help from related service providers. Each teacher would use a base platform. For the most part, we're looking at Seesaw for early grades, but also typically Google Classroom for the upper elementary grades. And we're also, as feasible, teachers will be able to work in their classroom and teach from their classrooms and have all those materials there available to them. We may have to do that on a rotating basis, but it will help our teachers, if the buildings are safe, of course, it will help our teachers maintain a regular work day, which was difficult in the spring. It will allow them to have access to all the materials they need, and in some cases, improve technology as well. So let me stop there and see if there are questions for folks that I can answer or elaborate on.
I have a question. I have some questions then for Jonathan.
Go ahead. Jonathan's not here, so go ahead.
Oh, okay. Thanks. Thank you for that. I have a few questions about the elementary plans. Obviously, based on what Karen Carroll said, being outside is less risky than being inside, and I see the PE and music maybe outside. Is there any thought of establishing some outside classrooms, either while the weather allows, having tents set up outside that classes, especially the younger grades, can process through and interact in a little bit more freely because they're outside? I'll just keep asking questions, and that's,
Wait, can I answer that one and then?
Sure.
Okay, great, thank you. So we've been considering that. We've actually, I was just looking at one of the best resources for helping schools do outdoor classrooms last night. honestly, one of the challenges we're having is just, I mean, schools typically aren't really good at like shifting gears dramatically. You know, we do it in increments over time. And so we are, I think, really challenged in imagining and operationalizing that sort of approach where we have outdoor classrooms in a significant way. I think we're gonna need some help on that, very honestly. In trying to just do all the work you're seeing here, all the work this represents, shifting into that gear is proving difficult, very honestly. I think it has tremendous value, but it's operationally very challenging. We did get quotes today on tents, so we are moving in little bits and pieces that way, but aren't we're not going full bore on that, and would need some additional help in some way to think through that.
Can the school committee, I mean, how could the school committee help you, or how could other city departments help you in that? And, that would be a question. Obviously, there's so much going on, but we would love to help at least with that research or possibility.
Yeah, I think, I mean, I could use an expert on that to get it done, if those exist. I'm not sure if even they exist, honestly, but I know we do, we could probably use, I'm sorry, I'm sort of stumbling here. I could use another person who could really sort of, sort of run that to ground and do all the detailed planning on that. I mean, there's some really, really detailed planning on that sort of thing. Not only on the how to structure it, what sort of structures to use, what sort of seating to use, but like how then what are teachers doing out there, how helping them understand how to use those things, so outdoor classrooms, how to change their planning and change their their teaching for that. Those aren't small things, so it's a great idea. Operationally, it's really challenging. I would love to sort of turnkey that, but that's just not, that's just so.
Okay.
Yeah.
Understood. So related to that and to the sort of airflow issue is, understandably, and I know you're still going to get to the part where we talk about exchange in the buildings and keeping windows open. I've been wondering about security elements while we're keeping windows open. We're now, we're dealing with this world where we're concerned with, active shooter drills and keeping our buildings secure. And now we're talking about opening windows, which makes perfect sense in this world, but that's just a question for me. And then Joel sort of touched on this, but so the cohort sizes, it seems like there's one possibility of a smaller cohort size and one possibility of a close to regular cohort size. And just wondering about the risks, the more children who are together, the more risk of transmission is my understanding. I'm not a public health official. So just wondering about that as we think this through. And then relatedly, are the kids going to have different teachers, or will they be with one teacher all day?
Mm-hmm. Sure. Yep. So in terms of safety and security, I mean, that's another challenge, which I didn't mention, about outdoor classrooms. That's a real risk, and that's something that when I met with the fire chief and the police chief, that's something they mentioned. The fire chief talked about the structures and can they be meet code, and then Lieutenant Michael Gossam, who's in charge of emergency planning, mentioned about the safety and security. In terms of open windows, I don't think that's much more of a risk. If you've seen our windows, they let air in, but they don't let people in, really. But open doors, I think, is a concern, and that's something that propping open doors is never a good idea. But windows is a whole different matter.
Okay.
In terms of yes, you're correct. In the 50% rotating AB model, there'll be more space with students, more space between students and classes. And there's also a significant decrease in in-person learning. And this is the crux of the issue here on this, And, I would think what the school committee and the community have got to really consider is if indicators are where they are now, which is, there are 6 cases in coronavirus cases in Gloucester right now, only 6, and in that situation, do we have kids in school, 4 or 5 days a week, or do we have them just in 2 days per week? And where we are right now is if things are at that level in Gloucester, that a plan for Gloucester makes sense, where it is getting kids in school for a shorter day. Okay, so they're not there for 6 hours; they're there just for 4 hours. They're safe. They're spaced apart within the guidelines, and they're with their teachers every day. And that's a very powerful. Being with our teachers is very powerful for our students, and so that's really what we're thinking on that.
And Ben, just to be clear, I mean, our teachers have their windows open now, even before COVID. Keeping windows shut isn't a new way to do business in our schools. The teachers have always opened their windows. I mean, we've had to replace certain window parts so that they can open their windows.
Yeah.
Sam, did you have a question?
Yep. So I'm trying to look at all of these different plans, sort of like what's best, or how this looks like for kids, how this looks like for parents, and how this looks like for teachers. And I get that that's like a super tight tightrope to walk, right? To sort of make sure that everybody is safe, everybody feels included. So I am very anxious to hear on Monday what parents think, what teachers think about all of these plans. So back to the 2 hybrid options, where I sort of have a hard time understanding is that what happens with after school childcare. So if we're trying to keep cohorts such that they stay in their own classroom as much as humanly possible, if parents need after school childcare after 12 o'clock, and that's sort of someone else coming in to do that, like the Y, how do we prevent cohort sort of commingling to make sure that we're not just increasing transmission? In addition to that, I think in this community, a lot of grandparents provide after-school childcare, and I'm really curious to see what people are going to say about that reality, being that grandparents might not be able to provide childcare because the risk, but also I'm curious. I think 2 days, full days, might provide parents with more flexibility than having to maybe get out of work every day at 12 o'clock. I don't know, but that just seems really tricky for parents if they're trying to work to have to get home for their elementary school kids every day at 12 or 12:30. And if they can't, then we're going to be relying on some sort of other provider. So how are we going to make sure that our cohorts are staying separate? And can we even, is that even a possibility?
So in terms of I want to actually invite, so we have our principals on here, as well as Greg Bach, Patty Wegman, and others. Adam's here from transportation. So folks, you should feel free to chime in and add to things I say, please. Your voice is welcome here. I may call in some of you at some point. In terms of after school, so we've had one meeting with the Y. There are real challenges on there, and best case scenario, our after school provider, main one, the Y, would be able to, have grade level cohorts, so they don't mix, first and second graders. Okay, that's what we're asking, and that's what we're hoping for. So that's one piece. The other challenge here is, I think it's an open question that you raise is, it's 3 days. The challenge with a hybrid model, regardless of what age you're talking about, is the rotating AB one is that 3 full days every week, the kids are home, and on the shorter day of the in-person hybrid, it's basically a 2-hour difference in terms of when, for those days. It's not more hours than that. It's an 8 to 12 versus 8 to 4. We don't know if the Y can put together the staff to have a, cohort model approach. So that's going to be a real challenge, honestly. But we really are resisting having that cohort mixing at the elementaries. We can reduce the cohorts in elementary quite small here. But we can't, whether it's after school, whatever after school folks are doing, or home behavior or community behavior, it's much harder for us to control how folks are doing. You heard Karen, and I would reiterate this, is, we have to maintain, appropriate distance and masking and all those other things we've been doing so well, even outside of school this fall also.
So I have another question.
Yep. Then you mute it.
Can you hear me?
Yeah, we can now.
So will the teachers provide the remote learning? So will they stay at the end of the day to provide the remote learning, or will that be sort of a separate group of people doing that? And then in addition to that, for the Remote Learning Academy, will that be a separate group, a completely separate group of teachers that are only doing remote learning?
So we haven't yet been able to work with our teachers on knowing what they can or can't do in terms of, are some going to do some have medical conditions where they can't come into work, okay? And then also some other folks might have family situations where it prevents them from coming into school. So our sense on the Remote Learning Academy that we'll have positions that needed and staff that will be doing and preparing and working with any students who are remote fully. That has to be worked out partly with the GTA, how that might work. So we do believe that there'll be a number of teachers who are really pulling together that Remote Learning Academy and working with those students. Those teachers also may be doing support on the remote learning for this afternoon. The remote learning here can be a variety of things. It can be working on pre-planned computer-based modules. It can be working on or reviewing lessons that were recorded at some point. It can be doing assignments that were prepared and gone and introduced in school, but now they're doing it at home. So there's a variety of ways to do those, and the good news is that teachers will have time, every day to do some preparation on that, and so it's ready for students to do on their own. They also may have support from the teachers who are staffing the Remote Learning Academy as well.
I just want to take this opportunity to let everyone know that Jonathan has left the meeting, so we'll give him an update tomorrow. Hopefully he's feeling better. Does anyone have any questions before Ben goes on? Nope.
Question.
Oh, Joe, go ahead, Joe.
Sure, and I think it's much later in the slideshow, as far as these each iteration, the elementary, the middle, and high school, I'll talk about, and if we have to transition into solely remote, here's what it looks like. But I didn't see anything in the slideshow that identifies what those trigger points are when we would be, and is that because they haven't been established yet? We keep talking about what it look like, but I don't know what triggers that.
Yeah, great question. And so Karen and I have both been talking to the same people on this. So interestingly, DESE was hesitating on developing these standard benchmarks of when to shift, like the state has for the opening phases. But input and really push from the Superintendent's Association have made them change their mind. And so they have told us they will be coming out with benchmarks based on community transmission and all the data that goes into community transmission about when to pull back. So we won't create those on our own. We'll use the state guidance on that, and we'll make sure, as Karen said, that what those are when we know them.
Sure, and I'm just sorry to follow up on this. Just that still a lot of people watching, but obviously it's dwindling. And so I just want to get this question out while there's still people out there.
Sure.
That guideline you seem to be talking about is more of like a community-wide, if there's X number of cases or a spike. I'm talking about, is there guidance out there that says, if my son goes into a kindergarten classroom on a Monday and then he's homesick on a Tuesday and gets tested and we find out that he has it, what happens to veterans school after knowing my son was there the day before?
Great. Sure.
What have they done to that school? They're doing that.
Yeah. Great. Good. Thank you for that clarification. So yes, DESE has already come out, and I don't have these in this presentation. It's easy to find them from our Back Together website, but they have clear protocols on whether a student has symptoms or a staff member has symptoms or there's a positive test. And there's two things that happen there. One is the school has to define things in terms of notifying people, in terms of quarantine, that sort of stuff, in terms of removing if during the school day, if a child has symptoms, there'll be an isolation room in each school. And we have clear protocols about how to run that isolation room. Okay, how it's got to be supervised. It's got to be separate from the nurse's office. Okay, so literally we've been like identifying those in our buildings. And then there's also the direct work with the Department of Public Health that does the contact tracing for that child or for that adult. And that contact tracing, of course, would include, for example, for elementary school, it would include all the kids in that classroom. Okay, and it is likely that all those kids would have to quarantine, and the staff member as well. Okay, that's what DESE has told us. So what happens at that point is, if we do have cases, that we could run into a challenge where, forget about community transmission levels, like those might still be low, but in a school or a classroom, in a school rather, you may have a sufficient number of staff. Maybe it's at at a grade level, or maybe it's across the school, that prevents us from running school, honestly. So it's potential you could have a closure, a move to remote learning by a school as opposed to the whole community, where community transmission is very low and one school has more cases than others. But that's the sort of thing that's what we haven't worked out yet, is what's the tipping point there. But there will be a challenge here around staff who, if they have symptoms or the classroom has symptoms, about what happens at that point with those staff.
Ben, can I just ask a question? Were you on a call yesterday with the commissioner? Didn't he do some sort of outreach to school leaders?
I was on a
the
call.
Commissioner Riley?
Yeah, I think it was yesterday. Yep.
Can you confirm, because I thought I heard this today, is it correct to say that there's an expectation from DESE that schools are going to open, and that they're putting out guidelines for questions like Jill just asked? They're going to be forthcoming with more regulations or guidelines and things like that. But is it true that there's the expectation that schools are going to open and that we shouldn't just go into remote only? Was that a topic of conversation yesterday?
No, what the commissioner said is, the commissioner is pretty clear. What with community transmission low in the state we're in Massachusetts, and his has been very clear about prioritizing in-person learning, with the safety guidelines. He, like so many of us, really, almost all of us, see the value in being in person. He did say, and he's just passing along information, that federal dollars may, and this hasn't been decided at all, may be tied to opening in person. Okay, I don't know that they're still negotiating that in DC, so I don't know. So there might be something like that, but so he's definitely supports trying to get people safely back into schools, I think, like we do, but there's no, he's certainly leaving it up to local school committees and local jurisdictions on that decision.
Okay, thank you.
Yep.
Ben, can I just ask a quick follow-up question to your previous conversation with Joel?
Yep.
So just to be clear, so that people understand, different cohorts are going to be riding a bus together in theory, right?
Yep, and that's why on buses you have to maintain the 6 feet of distance and masks.
Right, but so if somebody tests positive in one cohort, but they rode the bus, that could potentially trigger
an entire school shut down, not just a cohort?
I mean,
Because if you have, 25 kids in different classes, I guess sort of that's where
yeah, I guess I don't know on that specifically, and it probably depends on the specific case. They haven't told us that if a kid on a bus has symptoms that you have to, that everybody in that bus has to be, quarantined or tested. We haven't heard that yet. So I don't really know. I don't know that scenario, honestly.
Okay.
I think isn't there some sort of regulations as to exposure, how close you were to that person? I forget the exact terminology, and I'm sure Karen Carroll could have told us.
Yeah, so
it's not that you were just 100 feet away from somebody or 50 feet away from somebody. I think there has to be that close contact. So it might be the kids around the person on the bus, but not the whole bus.
Right. Yeah.
I don't know.
That's right. Yes, that's what they're saying. I don't know if I just don't know off the top of my head the specific protocols. I don't know if Adam knows this himself, but for contact tracing and quarantine for kids who are riding the bus. I don't know that, but we can get back to you on that. I'm sure it's pretty clearly out there. Let's move on to O'Malley, just because there's still a lot to do here. So on the full-time in-person model, O'Malley would run a 5-day cycle to make it simpler for folks. The time frames for specialist class would be redesigned. Community advisory time would be built into the day. However, despite those changes, this is not a model that can really work out in terms of physical distancing at the middle school for two reasons, really. Within the classrooms, we don't feel like we could get the proper physical distancing, size of the kids, size of the classroom, size of the furniture, and then also very specifically, the cafeteria could not handle this. At the most, we could get 88 students in the cafeteria at one time. And you couldn't create a schedule that could actually, feed all the kids in the course of a day, essentially, in a reasonable fashion. So this approach, full-time in-person model at O'Malley is not recommended. We're going to show you at least, the preferred model, which is a full enrollment hybrid, and then also just talk about a backup model as well. And if you guys have questions, Lynn is still on the call and she can also help me answer questions as well. So students are attending school 4 days a week from 7:40 until 12:15. And then after they head home from about 12:45 or 1 o'clock, they'd finish the day remotely. So similar to what we showed you for elementary, but just a little bit different schedule. Students would have an eight block program over 2 days, facilitated by staff assigned to their house. They'd be organized by houses. So instead of having houses of 6th graders that cross over with other houses, which they do typically, they would be centered around just their house. Okay, and then we'll also would adjust the specials. So they're with one special teacher each sort of term or each chunk of the year, rather than going to having mixing or having multiple specials at any given time. This limits the cohort, limits the changing, and they still get all these specials across the course of a year, but it's just in a shorter amount of time over the year. This model would have grab and go lunches before going home. Grab and go breakfast can be done in the school because you serve fewer students, but those would be very designated spaces that could be where kids could be 6 feet apart while they're unmasked. There's some real advantages or strengths to this approach. I think the number one is that you have a class size of only 12 students. What they're able to do, they'll have all students in classes, but they're able to organize this and schedule this in a way where you only have 12 students in a class. That improves in-person learning, improves connections with staff and peers, it improves the ability to support special education students. It allows for better social emotional learning and connections. And you have 4 days in the building with students where students can access teachers, counselors, and other support staff. This is all students in the building, but they're spread out in a way because we're going to use every classroom with only 12 students at a time. That allows us to have 6 feet of spacing. You can see here 2 photos where one is the use of desks. So you see spacing, kids are really far apart. That's a typical O'Malley classroom. On the other side, you have a classroom, actually it's the smallest classroom in O'Malley, and it's using tables at this point. But again, kids are 6 feet apart here, and they're able to do that even in the smallest classroom because there are only 12 students in the classroom. This approach allows kids to be in school with their teachers 4 days a week and then 1 full day of hybrid, which is more manageable because in the class period, teachers can better prepare their students for the work they need to do and will do on that 1 day of remote or when they're in the afternoon as well. You know, that combination of, you know, working with students regularly and then having a limited amount of remote time can work well. It's when we're in full remote that it becomes challenging because you don't have that in time to give kids real guidance and direction.
Can I have a quick question about that?
Yeah.
So I have a little confusion, and you know, hopefully this is just something that I'm missing. I'm confused about how we function or how we handle a class size of only 12 students under the full enrollment hybrid. I mean, I imagine there must be extra space in the building because it used to hold a few hundred more students than it does right now. But as far as like the staff, you know, when you have a class that used to have 20-something kids in it, now it just has 12, you know, how does it work out with the staff ratio?
So part of it is, and Lynn, you might want to chime in here, but let me give it a shot. It's about how you're organizing the staff. So we need a little flexibility on staff but each house or each cluster, I should say, you know, has an appropriate amount of teachers between, you know, the core academic subjects, such as education, a paraprofessional, and also a specialist. So when you're organizing those, and it does require some additional staff, okay, which we'll talk about later, including especially special education teachers, maybe some paraprofessionals as well. But because of that, organizing the staff in that way, where they're sticking rather than you know, rotating among students of all grades, but they're sticking with one block of students, that's what helps us do that. So it's some additional staff, but also the way you're organizing staff to work with students. And also what we're offering them here, we're narrowing the offerings a little bit and making them a little more sort of consistent, or consistent, I guess is the word. But that allows you to do that. Lynn, I don't know if you want to add anything to that or if you think I did a decent job. I guess that means she's either.
No, I think you covered everything. Yeah.
Great.
So again, I'm really sorry that I still, you know, this. So in my head, I'm going, okay, how does O'Malley function normally? So I think of a house, right? Either a 2-class house or a 4-class house. And so the 4-class house usually has 4 teachers, right? 1 in each of the rooms, and enough students to fill all 4 classes at one time. And they kind of rotate through and then go out to specialists at different times. And so I just don't understand how you kind of chop the number of students in a room at any one time in half without doubling the amount of rooms or teachers that are there to handle the fact that you've now cut the classes in half.
One more piece on this, and I think Lynn might want to chime in, is that also at any given time in a high school or middle school, you typically have a bunch of teachers who aren't teaching at that point because you're rotating their open blocks or their common planning periods throughout the day. Whereas these are, seeing as these are consolidated, that meeting time is consolidated at the end. They're all doing it at the same time. You have essentially your whole staff working in the morning there all at the same time. So that also helps you as well. Lynn, anything else to add to help?
Yeah, no, I think that's the important point. It's the reconfiguration of the schedule and the staffing with what you just mentioned. Everybody's teaching all the time. And then it's the redeployment of our special ed and support staff so that they are either teaching or, in the case of paras, just monitoring and supporting student assistance. So more people are taking a group of kids on their own than normally would, which, because the groups of kids are so small, works effectively. It would not work as effectively to have a group of kids necessarily if there were 24 in the group. But because the cohorts are small, we can do more in that intensive time with the different services we need to deliver. So it does allow us.
I'm sorry.
Okay.
So would this mean that under a normal circumstance, doing the rough math in my head, at any given point during the day in O'Malley, a third of the classrooms are devoid of students, and that's where we have all this capacity to put students in smaller groups into those classrooms that used to be empty during planning periods? Is that how this works out?
Yeah, approximately, because what we have an on-team, off-team structure. So the house teachers are teaching, and when they're not teaching, the kids are in specialist classes. So it's 10 teachers who are off at once when kids go to specialists. So there is a swap around. It's probably more like a quarter of the classrooms than a third. But yes, and in this situation, we're going to not only be using every classroom, but carving out some other spaces. That, for example, Officer Sutera's office is going to need to be relocated because that's a room that's big enough for a small group support class. We're going to use 2 spaces off the library as classrooms in addition to the main central part of the library as well. So we're maxing out every possible resource we have. And then, as Ben mentioned, there's an acquisition of a few other staff that would be needed to make this work.
And I will say this, Mr. Vavaza, I mean, when I first heard of this too, I couldn't get my head around 12 students, mostly because that's a tremendous advantage. I mean, to have that, and especially in middle school, to have 12 kids in a class is it's, I mean, I don't want to say revolutionary, but it's like a really big deal to be able to have these kids in a small class like that with their teachers, many days a week. That's a really big deal because they can support them closely, they can get to know them well. These are decent sized blocks in terms of length of time, and they really have this team approach where, those 8 teachers or 8 staff members are just with those group of kids. So, it's a powerful approach. And I give I give Lynn and her team tons of credit for sort of trying to work this through and work this out. There's some challenges we have to face with it, definitely, but it's a long way in getting there. I think I saw some other questions.
Go ahead, Kathy.
So I just want to also back up in terms of the work of the working groups. So I assume these ideas and these kind of scenarios have come from a combination of administrators and teachers and sharing what, kind of brainstorming what this would look like. Is that correct?
Yeah, Lynn, can you speak to that?
Sure. I can take no credit for this model, actually. I can take credit for, sort of modifying and finessing some of the ways we would implement it, but this was purely teacher idea.
Thank
And I've seen it workshopped a little bit at our district-wide, reopening team. So as we break into small groups on Zoom on that, and then also obviously, Lynn's been working through with staff, at the school as well. But yeah. My role and our district office role in this is to see if we can, get the resource to make it happen. That's really been our role, and also to ask some good questions, and which I hope have been helpful along the way. All right.
Any other questions? Okay.
I'm going to let the elementary school principals and Lynn go. If that's okay with it's getting late, and some of us on here have signed up for those late nights, but not all these folks have. Is that okay if I do that? If I excuse the elementary principals and Lynn, and we'll keep James here a little bit longer. All right. Well, thank you, folks.
Absolutely, and we thank them for the time for being with us tonight.
Great. All right. So James, you can hang on. The rest of the principals are free to go and get a good night's sleep, I hope.
Next time James gets to join later than the rest of everybody.
That would have been better planning. You're exactly right, Kathy. Thank you.
Thank you, Kathy.
Let's see here. So I'll take this. So full enrollment hybrid. So this actually goes through a lot of what we talked about in terms of, special education can be provided well because we have, support liaisons and paraprofessionals built into that house structure. We talk about the different staffing allocation. This is actually what I should have shown before in terms of what staff is in each house. Okay. Hybrid option 2 this is not preferred, but this is going back to the A/B rotation. So option 1 would be students in school Monday and Tuesday, and then a different cohort of students in Thursday and Friday. We actually think option 2 is better on this because you don't have as much gap. In option 1, if I'm a student in school Monday and Tuesday, then I'm not in school again with my teachers until the following Monday. So that's a pretty significant, I guess, a 5-day gap of being in school with my teachers. Whereas if you look at option 2 here below, I would be in school Monday and Thursday. That's a 2-day gap. And the cohort B would be in Tuesday and Friday. I think I have that right. And then you have the gap, the opening, the full remote on Wednesday. I think here shows a full remote could be Friday. Again, we've seen that, having a long weekend between in-school sessions actually extends that out of school time a little too farther. So really what we would have is one cohort is in on Mondays and Thursdays, one cohort is on Tuesdays and Fridays, and their fully remote day is Wednesdays. Again, that means that a child's only in school 2 times a week. It may mean, depending on how you're scheduled, they're only seeing a teacher 1 time a week because they're having, could have, all classes on each day or half their classes on one day. So that's a real risk. That isn't nearly as much time as the preferred, full in hybrid we're talking about. So this gives you an example of this is a better representation. So the red is cohort A, and that's when they're in school. The yellow is cohort B when they're in school, and then the excuse me, the white is when they're both remote. In this example, kids are going to all their classes on each day when they're in school. This is challenging because there isn't much time for folks to prepare or put together remote learning. So for example, when teachers are teaching on Monday, cohort A, they still have a whole half their students doing remote learning. And because they are teaching every day in person, developing the remote becomes quite a bit more complicated and difficult to staff, very honestly. And the remote model, similar, we'll tighten it up quite a bit. I've been doing a lot of work on this with the remote learning groups. They follow a daily and weekly schedule. They'd be using Google for all remote and hybrid learning. There'd be a combination of synchronous, meaning live teaching, and asynchronous. One bit of feedback we've gotten is when students are doing work, they do it while they stay on the remote platform, and the teacher's still there while they're doing work. The teacher isn't instructing at that point, but it's sort of like when you have work time in a classroom. The teacher's there for the student to ask questions. The teacher's there to see the kids are doing work. They just don't shut things down and go off and work on their own. They're actually still on the screen doing work. It's just not the teacher isn't like talking at them, but the teacher's there to support them. So that's something we've heard that would be an improvement as well. We're looking in to see if teachers can work from the staff building even during remote times. And then attendance and grading will happen as it typically would. We'll have to also regularly monitor progress of students according to our standards and state learning standards as well. And we've got some developing some remote systems to be able to do that. So before we go to Gloucester, any last questions on O'Malley? Great.
I don't see any.
Okay. Well, we'll dig in here. And James, if you want to go off mute in case there are questions, you can. So there's been a feasibility study of all learning spaces in Gloucester High, and that has revealed that the full in-person model would definitely be challenging. The physical classrooms would not support the DESI mandated minimum of 3 to 6 feet. You'd have real challenges in terms of all the transitions, all the traveling between classes, the mixing of students, and also the 6 feet between students during lunch is extremely challenging and very difficult to staff. So it looks to us that a full in, regularly scheduled approach at the high school, even if you had masks and hand sanitizing, that sort of stuff, the distancing and the transitions and the number of movement, the amount of movement make it very hard to do that well and do that safely. So high school, I give James and his team a lot of credit. They've been digging through a variety of different models over the last few weeks. A week on, week off model we discussed earlier, the rotating AB model, and where they are now after looking at all those is really looking at a split day model. We'll look at the AB and the split day model tonight. All of these approaches would have about half of the students in the building. It still would prioritize high need students, but having half students in the building allows for better physical distancing, smaller cohort sizes, and much fewer logistics and operations in terms of transitioning and moving around the building. You'll hear us talk about crimson and cream cohorts. So if you're splitting the school into the high school into two groups of students, you might as well call them after the school's colors, crimson and cream. So we'll be talking about that tonight. Again, week on, week off. I've described these already. The crimson students for the AB model would be in school Monday and Thursday. The cream students would be in school on Tuesday and Friday. All students would be remote on Wednesday, similar to what we just went over for O'Malley on their AB model. The split day hybrid is quite interesting and actually is happening in more and more districts are looking at this and hoping to get it to happen. This is a morning and afternoon session. The crimson cohort would be in person in the morning and remote in the afternoon, and the cream cohort would be remote in the morning and in person in the afternoon. So I'll show you the schedule in a moment. High need students would be in person for 4 or 5 days, as long as the building doesn't have to shut down completely. So the split day, we'll focus on the split day hybrid here. Again, all students have in-person learning 4 days a week. Each 3-hour in-person day consists of 4 periods. So over the course of 2 days, they'd have all their classes. Grab-and-go lunch and breakfast would be handed out to students as they were leaving for their next 2 meals if they need them. And I mentioned about high-need students being in most days. This is the preferred model. Has fewer passing transitions, kids in school much more. It's possible that students would only see in the other hybrid models, rather in the rotating one, only see a teacher once per week, which means they'd be doing remote learning in their classes 4 days a week for the most part, which isn't sufficient. This model, the split day model, certainly allows for better academic support because they're seeing the teachers almost every day. That leads to better social emotional support and also better connection with their peers and with teachers as well. And also allows for an extended homeroom period twice per week, which is one of the really foundational elements of creating connection in the high school. This is a sample schedule that you've seen. It's also on the website. This example shows you that the crimson cohort is in person every morning. No, actually shows that we're switching here, I believe.
That's right.
Is that right, James?
That's right. Yep.
Okay. Great. James, can you just talk about the advantage of switching which cohorts are in the morning?
That's right. Yeah. So that was an innovation that came from the reopening committees. You've heard a lot about, at the elementary and middle school level about the benefit of having different people looking at this together. And so we talked about, making sure that the sort of, right, if have some challenges getting up in the morning as a student, right? In this model, that's a challenge 2 days per week, but the other 2 days, that's you're in the afternoon part. So if some students are late regularly, they have difficulties in the morning, and in this model, that doesn't take away as high a percentage of their learning as it would if one of the cohorts was always in the morning and the other always in the afternoon. Other adjustments that came up in the schedule you're looking at now were some adjustments to meet contractual elements, such as making sure folks are getting their prep every day. Also, there is currently, I received from a teacher, was able to review today a variation even on this that might even be a better rotation, but I'll be discussing that tomorrow. So similarly, we're continuing to innovate, but the key elements here and advantages over the other plans is this gets students into the school most often. It allows them to focus on 4 blocks of learning per day, both in person and the remote aspects of learning for those 4 blocks each day, and then another 4 blocks the next day. And if you look at Friday, it really allows us to focus on some of the communication, the outreach to families and students who might be struggling, and really building on some of the strengthening of communication that we were able to do in the second half of the spring this year. So we're really excited about the contact time that this plan allows, and the support for students who might be experiencing difficulties.
Great. Thank you, James.
Does anyone have any questions? No? Thank you. Okay.
Great. And then the last piece on this is with just the full remote learning. Crimson Cream cohorts will be blended in that point. All students would participate in synchronous remote learning, and have teacher support in the morning, and structured self-directed remote learning as well. Some expectations, again, weekly structured schedules with a combination of daily synchronous lessons, asynchronous work, and offline work. Attendance will be mandatory. Students will be assessed and graded on all of their work, just like they would be in a normal school day or regular school day. And the expectations will be created for online engagement in terms of participating in class discussions, grading and feedback, and also engagement in lessons as well. And that just, as you've been seeing this whole time, when we go to remote learning, or if we go to remote learning, these are just some of the structures that will allow for just clear expectations, clearer work, clearer communication with families and with students in terms of how they're working, how they're being assessed, what they should be working on, and that we are sure will lead to better success in that. This will be the full remote schedule for the high school. You can see that that there's synchronous work in the morning. So with teachers online with students, that's a combination of teaching and lessons, but also work time where teachers are there present with their students. And then that's also setting them up for the asynchronous work in the afternoon for those same classes. So again, because teachers have them there, because it's a better schedule, they're not only working with them live, but then helping them know exactly what to do in the afternoon and helping them be accountable for those things and that work completion in the afternoon. So, any questions for
Kathy, go ahead. Kathy?
So is this similar to the middle school when they are online with students, they're staying online with students during the full session of
yes,
the block?
That's what we're working on. That's right. What I do want to just mention here, some folks think we can just turn things on and we're constantly with, you can teach for an hour live with remote just speaking, and I don't think anyone wants that. I don't think parents really, I don't think students could actually do that. I don't think teachers, that's not a good way of instructing actually. You have to have chunks, and what the high school is working on is chunking. You have your classes chunked where it's some teacher directed, some teaching, direct instruction. There's some work time. There's some group time, that sort of stuff, and that's the sort of thing that we're working on. So the teachers are still there monitoring, and the students are still there online, but it's not simply just teachers, talking at students the whole time, because that won't be effective for anybody.
Yeah. One of the things, Ben, if I may, that we found is different ways of creating groups, breakout sessions, in Zoom format, for example, that you may have used, and using that 40 minutes, not just to have all the students together at one time, but, how can we use a Google Meet and a Zoom to create the small group work that we might do, in a regular class time, presenting material to students, and then the teachers there to help them process that or do some problem solving and work closely with some, a handful of students who might be having difficulties. So there are all sorts of real developments in how we use the synchronous block of learning remotely. Things we just didn't know in March that teachers have learned and then have been working hard all summer in building something we're calling a remote learning catalog, which has resources and tools that then the other teachers can benefit from. And that's happening not only at the high school, but it's happening at all the other levels as well.
So are you talking about utilizing the breakout room function and things like that during the class time?
That's exactly right. Yep.
Yeah, great.
And we're looking at bringing on Zoom as one of the platforms, but also Google is also developing for its education enterprise suite breakout rooms as well. We're not sure when it's going to happen, but so we should have two tools that folks can use. Oops. So Remote Learning Academy, I don't think we've got too much on this, but just, and I've actually covered most of it. Just the notion that, we do know some families will opt out of in-person learning for whatever reasons they have. That's, for their best for their family. We'll work to accommodate those with medical documentation, of course, but families can do this for whatever reasons appropriate for themselves. We are expecting and looking to build a remote learning instructional team with staff. How exactly we'll do that, we will talk about later, and that will also be to some degree subject to negotiations. But we do have a sense that some number of staff, although not many have at this point, won't be able to for medical conditions to teach in person, and may be able then available to be part of the remote learning instructional team. And if we think about 20%, just to use a rough number, that could create about a classroom or so or at each grade level, and so we have to staff it for that. It's a little simpler at elementary, a little more complicated at the upper grades, but that's something we're working on. That will depend on number of families who need that, and then also number of staff who may opt for that as well. Yeah, question on that?
Ben.
Yeah.
Yeah, can I ask you a question on what you were just talking about? So Boston tonight, the superintendent came out earlier this evening saying that they're headed towards a hybrid model. The school in Boston is starting on September 5th, which is earlier than most, and that they are going to survey their parents now, meaning they haven't done it already, to find out who's coming back and who's not based on the plans that are out there. We did our surveying before the plans came out, before we had this meeting, before the conversation started. Is there a way to survey again? Because I don't know that I trust that 20% figure. It could be higher, it could be lower, I don't know. Yeah. But I think as these plans evolve, parents are going to be making decisions, staff are going to be making decisions. And I just would want to be dealing with accurate figures. I mean, right now, we believe that the majority of parents want their kids back in school, and then the majority of staff believe that there's some sort of model to get back into school. That could change on a daily basis, as we know, like the world changes on a daily basis when the COVID stats go out there. But is there a way to survey again to make sure that the figures that we're depending on right now in these conversations haven't changed?
Yeah, so we are planning a survey again, and a couple things. Right now, because families had to fill out for each child, so they actually attached a name to each survey. So we have that information, and we do have to survey again, and survey in this, when I say survey again, it may be much more granular. It actually might be committing to something, okay? And so that is why, like you said, now the plans are out, now that we're working on them, now that you'll work on them, or ultimately vote on them, and voting on how we begin. Two things. One, we will have to know from each student and also staff members, who's going to be doing what, and have to nail that down very clearly, like individual by individual. And then also, I mean, next week when you vote, you may support the preferred plans, but what everyone needs to realize is that, it might change between now and September, 14th or 15th. And we have to be prepared to do that. We can't stay in lockstep just because we made a decision and stick with that if the health data shifts in any substantial way. That's a tough thing for all of us to be in, but that's why we have been working to develop all three approaches basically. So, but yeah, we'll survey parents again just for that reason.
And what do you see as the deadline to know? I know some school districts are giving parents deadlines to commit, whether their child's coming back. I mean, I don't know that that's necessarily a good thing, but I understand it because things change so much. Do you see us having to function on a deadline, or we're just going to be prepared either, no matter what?
No, we have to function on a deadline, and I don't know at this point, honestly, what the deadline is. It's probably going to be somewhere in the
Okay.
third week of August. But I mean, because especially if we're doing, because we're doing remote learning academy, we have to know, and because we're actually building classes and schedules, we really have to know that.
Yeah.
The other piece is some folks have asked, can parents switch and change during the school year? And we'll at this point, what we've talked about is having terms for when people could switch, because having a child or a family switch week to week or day to day or that sort of thing will wreak havoc both in that child's life, I would imagine, but also in terms of placing that child and keeping that child up to date and that sort of stuff. So we'll have to have defined times where families can shift. Yeah.
And one more thing too. I know Jonathan and Samantha were part of the forums that have happened, and they were privy to more information than the committee as a whole is drawing. Can you talk a little bit about what the DPW stated as the status of the buildings? As you know, there's a push out there to declare every building in Massachusetts unsafe for not having the ability to handle the airflow. So I know our buildings have been looked at. Is there anything you can give us as far as a report on behalf of the DPW, knowing they weren't here tonight? Things that might have been said at other meetings that we haven't been privileged to hear?
Yeah, I don't know how much, I'm sure Melissa, honestly, how much the community stakeholder, which met one time last Thursday, and how much more information they got than we've gotten. So, because I mean, we talked not much about facilities at all, really. But
Okay.
So,
I thought Michael was there for a meeting.
Mike Hale he's on the community stakeholders group. Oh yeah. But he didn't maybe he answered a question or two, but.
Okay. I thought he gave us some sort of report. That's all.
No, I may be remembering incorrectly, but it wasn't anything. So this is what we know. Right on the screen here, you can see that, right? You can see the screen.
Yep.
Okay.
Yeah,
Good.
we can see it.
Okay, good. So they're reviewing and have hired a consultant to review the HVAC systems at O'Malley, GHS, and West Parish. And those are centralized systems, so that's why they're doing that. Okay. DPW and GPS will review East Gloucester, Vets, Beaman, and Plum Cove room by room. Our focus in all of this is introducing fresh air from outside into the buildings. So you can do that more centrally with the O'Malley, GHS, and West Parish systems. You've got to do it room by room at the 4 elementary schools here. That may be opening up vents that haven't been opened. That may be introducing individual air exchange units in rooms. That also may be, as Desi suggested, adding box fans to rooms to get fresh air in. As Karen Carroll said today, fresh air in is really the most important thing in terms of this. So that's one piece in terms of air, and that's work in progress. And we're meeting with Mike and Joe Lucido again on Friday morning to get an update on that. And then so then there's also cleaning, and we are identifying and pursuing additional cleaning support through external contracts at this point. We think that's a better approach, because if we go fully remote, if we hire a bunch of cleaning staff, custodial staff, and then we go full remote, we don't need them. And that just then creates layoffs or furloughs, and that's a very difficult way to go. But we priced out additional cleanings to sort of essentially double our cleaning staff in the elementary schools, and increase it as well at middle school and high school, so we can have ongoing cleaning during the day, and then fuller cleaning after people have exited the building in the afternoon. So that's really the update.
Sam,
there. Yep. Go ahead.
Sorry, just a couple follow-up
Sorry,
questions.
Sam.
So will we get the report on the HVAC and the air quality room by room at the schools before we vote on the plan? That's my first question, so I'll let you answer that one.
You'll know what we are doing in rooms. I don't know if you'll have, I just don't know what the timing is on the report that DPW is having at O'Malley, GHS, and West Parish. Sorry, I don't know the exact timing on that.
Okay.
But you will know what we're doing at EGS and Vets and Beaman and Plum Cove. I don't know if at that point you'll know room by room, but you'll know, like, you know, we're using box fans and we need this many in the school. We're going to look at, looking at air exchange units, that sort of stuff. But we'll be as specific as we can be at that point.
Yeah, I guess so. Box fans and air exchange units, sort of, I guess I'm just trying to imagine it, right? So if there's box fans in every room, plus teachers are wearing masks and face shields, you know, what's the quality of teaching that's gonna be had? That seems like a lot of barriers to people being able to hear. So I guess how each classroom will look and feel and sound is definitely, I think, important. Just thinking through just the comfort level of the classrooms, just as a thought. In addition to that, I know that they were installing no-touch toilets, no-touch sinks. What's the status on that? Are all the schools getting that? All the bathrooms getting those?
I don't think we're getting, there's been any mass, I'll look into this, I'll find out. Maybe Greg knows or Gary knows, but I'm not aware of any massive changeover in toilets and the like in our facilities. Maybe that there were some changes in toilet in bathrooms at O'Malley over the summer, the spring and summer. Gary, if you know more than than I do, you are welcome to add.
Yeah, I could have sworn at a BNF meeting.
I think it was only at O'Malley, Sam. I think when they were redoing the bathrooms at O'Malley, as part of the bathrooms that got charted at O'Malley, they happened to be putting in some touchless hand dryers.
Right.
I don't think there was otherwise any work that was going to be done elsewhere.
Okay.
No, yeah, and I saw both those bathrooms and the hand dryers at O'Malley today. That's completed that work.
Okay.
But yeah.
So so the contracts that you're gonna have cleaning people come in, will they be there during the day or are they coming in after school?
We want to supplement the current custodial staff there so we can have continuous cleaning throughout the school day and then have additional cleaning at the end of the school day, after school day is over. Right now, basically, we essentially have custodians, my understanding is custodians that are scheduled, to do, so they're there for part of the school day and then after the school day to do the cleaning of the school. This essentially, allows you to have both of those things.
Okay.
Because during the school day, with the custodial staff we have right now, just in terms of number of people, they couldn't actually be doing the high touch services throughout the day on a rotating basis. They would just be, just managing the building at that point, really. There's very little cleaning they're doing during the school day, but this would allow us on a rotating basis to have, cleaning of high touch surfaces throughout the day, throughout the building, as well as cleaning at night or cleaning after the end of the day.
So this is sort of an outside group that could be coming from anywhere coming into the schools?
I don't know about their employment practices.
I would guess from the city, it's going to be a certified cleaning company that's bonded, that is educated on how to disinfect. We have one coming in the courthouse.
Mm-hmm.
Yeah. I mean, it's a choice. I don't know how these folks would be different than our custodians or our staff, but we're seeing them as essential to clean the buildings.
I think it's absolutely important that we have more cleaning people. I'm just trying to understand if it's going to be a separate company, will they have separate protocols than what we're having, and how do we sort of navigate those differences? That's all I'm saying. I think we definitely need more cleaning staff, but you
Yeah,
know,
my
how do
guess
we-
is the DPW will negotiate a contract with them and give them the expectations. You know, we're gonna tell them what they're hiring, what they're hired for, and what our expectations are, and it'll be put laid out in a contract, and that's how they'll move forward. That's usually how that works.
Okay.
And they'd be Cory checked as anybody else who's around our students.
Yeah. Ben, can you give us an update on any potential support for the nurses? Because I know that's a big concern too.
Can I
And I know the mayor has mentioned some support.
Yeah, can I just go, I like to go through high need students. This is a group we haven't talked about, and it's actually a
Oh,
really, really
sorry,
important
I thought
group.
we were done. Okay.
So, and
No, go
Patty
ahead.
Wegman's here. So Patty, can I have you, if you're here, I see your names here. I hope you're still here. And thank you for being patient and waiting. But Patty, if you could go through just the basic approaches that we are doing with our high need students, that'd be very helpful. I think we have a couple of slides here.
Sure. Thank you, Ben. So the Department of Education has really wanted us to prioritize our high need students, and just for the committee's edification, high need students per their IEP is designated as students that receive, there's a sort of a threefold determination. They look at how much time they are spent outside of the general education classroom. They also look at the number of service delivery providers, whether it's OT, PT, speech and language, as well as how much service time they're spending with special education teachers. So there's a formula that's utilized in order to determine whether or not a student is high needs. So we're actually using a calculation to determine whether or not a student is high needs. However, the department has also said that we need to include students that are ELL learners, students that had difficulty participating in the remote learning in the spring, students that are homeless, and also students that, for whatever reason, because of their disability, could not participate in remote learning, being identified as high needs students. So we are maximizing the amount of time those students participate in in-person learning. And as you saw in Ben's slides, we are trying to, again, have those students in our buildings every day, all day, as long as we can provide a safe environment for them. We are expanding our ability to provide remote learning if we need to move to a remote learning platform. We have a number of initiatives going on right now as far as some different platforms in the area of speech and language therapy, and in providing services for students that are present with some very complicated high needs disabilities. And I see that, Ben, you've got the identification of high needs in front of us right now.
Does anyone have any questions?
I have a question. I'm not sure if this is for Patty or for Ben.
Okay.
But are we, again, there's a lot of focus here on preferred model being some sort of hybrid, and then having this plan B or this contingency where things go to remote. And one of the things I talked about was if we go remote, if the building's safe, it'll still allow teachers to enter the building and kind of teach remotely from the building, that sort of thing. I guess one of my concerns is twofold. Is one, is there planning in place that allows us to do a tiered retreat? So if something happens where either transmission levels in the community are too high, or there's a specific incident in a school that requires us to pull the trigger on going remote, that we can still somehow allow high need students, ELL students, to still, to not be also thrown out with everybody else because of this. And that, we can discuss this later, leads to the concern about, the going to this model, because we risk, if it's not that way, we risk losing everything, right? If there's a model where it's just these kids in the building because they really need to be in that building, and most of the children are not in that building, there's less of a risk of us having to pull that trigger on the remote only. And so I'd like to know if there's plans in place. This is a super long question. It's funny, I gave Sam hell for doing it earlier. Super long question, but the question is, believe it or not, at the bottom of all this, if there are plans in place so that if there is some sort of shutdown in the district, that we can keep, either they all go to one building or something like that, to keep these students able to meet with staff in person longer than other students would otherwise be able to.
Yeah, it's a good question. We've thought about that in terms of, or we're thinking about that, I should say, in terms of, can you still do that at the schools? Okay, in some ways they're the obvious places, because it's not the school that's sick. It's the people who may be there, and so I think we have to look closely at, community transmission and how severe, or just what stage we are at that point. So schools can be used in that case. The other piece on the hybrid version as well that we're talking about, which is, well, it's not really, these kids, high needs learners would still be at the school. So the example I was going to give you is something related to actually general education students, not high needs students. But so I think the first place we actually look to do that in, because if it's safe to be at a community center, or at a library, or some other spot for high needs learners remotely, it's probably also safe for them to be in a school building, So, but Patty, let me ask you that. I feel like we've talked through a little bit here or there. I think I maybe had a slide on it that if the buildings are okay, then we could still have high needs learners in them in the situation that Joel's talking about. What do you think about that?
Sure. The guidance speaks specifically to the fact that if a school needs to implement a hybrid or a remote model, that we need to the best of our abilities, keep our high needs learners in the buildings. And just to speak to Joel's question about, do we put them in one building? We're talking about highly complex learners, and their needs are such that they learn the best in their familiar environment. So they would want to stay in their familiar environment. So we wouldn't want to, or we would, to the best of our ability, keep them in their most familiar environment with the most familiar staff.
That makes sense.
All right.
Joel, do you have any other questions, Joel?
I'm good for.
Okay. Just a few more things here. Planning for additional resources. So we've been looking very closely and working with principals and others about where we would, need some additional resources. We need to supply additional staff and resource and material supplies to make these things happen. And this is really looking at the preferred plans. So source of funding, there are quite a few sources of funding, and maybe if the Republicans and Democrats in DC can get together, there may be a whole nother source of funding, and maybe substantial. But there's your CARES grant, the ESSER grant. School committee has set aside a contingency. There's a state technology grant, which we've already pursued, and I think we're awarded, and then also a COVID relief fund grant as well. So, like I said, maybe more coming. Additional human resources. So this is additional cleaning, the contracted services, nurse and health aides, unless you asked about this. And also the mayor has also talked about this too. So we do know that, nurses won't be able to do it on their own. There's going to be an increase in what they're expected to, cover and support. And so that could be nurse aides, health aides. That's for folks to staff the isolation rooms, but also make sure that students who have complex needs and may need much more care and support can get that care and support safely, and doesn't take the nurse away from other duties. So that could be health aides we hire. special education teachers, particularly for the O'Malley model, paraprofessionals as well. What I don't have here, but we've costed out, are bus monitors as well. We'll need bus monitors. We think 12 of them because of the guidance and the sort of the behavior that has to happen on buses. So that's in the neighborhood of $1.5 million, and then $32,000 for additional supplies and materials that we above what we have already purchased or already secured. So, for example, health and safety signage, we already have a bunch of that for the elementary schools, already done and taken care of. We also need traffic flow signage. There's additional PPE. We already have thousands of masks and other PPE on presently. We've already purchased those. So this is in addition to whatever we need. That can be clear masks is one thing we're purchasing for teachers, but also face shields. We priced out disinfecting foggers, which will allow disinfecting to happen more regularly in buildings, and also a much faster way to do it. May need storage for extra furniture, and then things like room dividers to break up learning spaces are also plastic dividers for when related service providers are working, one-on-one with students. And then we talk about as fans as well. So that the cost for supplies and materials isn't very exorbitant because we have a lot on hand already. We do feel at this point that these sorts of funding can just about cover what we have shown you here. And there may be some additions as we go along and really nail down all the logistics and operations of the plans. But the preferred plans are probably at this point the ones that have the most additional costs, and so that's why we've summarized them here. Any questions on that? Okay.
I don't see any.
Oh, the things we're still working on with GHS, perhaps having the split day. Working with CADA on transportation in the afternoon. CADA has taken on the shuttling for the railroad, but even with that, they can cover us. But we still have to work through things on the afternoon transportation with them. As I mentioned already, still working on fresh air intake, especially in 4 of the 5 elementary schools. The staffing and hiring additions. These next 2 are, which I just mentioned, the next 2 are really big pieces here. All the operational logistics of putting this stuff in action need to continue to be worked on and nailed down. That's protocol, everything from protocol, how kids enter the building, how they are dismissed, how they're doing snack, how they're moving around the building, protocols for when students or staff have symptoms, which I mentioned. Was speaking to our nurse leader this morning, and he'll be basing all of that on the DESI protocols. They'll be approved by the Gloucester Department of Health, and then already working on the 10 days of professional development before school starts. The one thing that is very important that you'll have to decide on that I'd like to look at tonight, if we have time, is the school calendar. Okay, because you folks will have to decide by next week what the school calendar and what the actual start date will be. I emailed to you just before the meeting a recommendation on the school calendar. Let me just put this up here. And that would be that we would start on the September. So we are required to have the 10 days of planning and preparation for staff in our schools before school starts. We have in September, I don't know if you can look at these, but we put it in your packet there. In September, by contract, staff get the Friday before Labor Day off, and they of course get Labor Day off as well. Okay, so if we started with these preparation days on August 31st, we have 4 days that week, Monday through Thursday. The next week we have 4 days, Tuesday through Friday. That's the 1st through the 4th that's the 8th through the 11th of September. That's only 8 days. We would do the 14th and 15th and open on the 16th. What we'd be hoping to do is have sort of a rolling beginning So we get students in to practice some of the protocols and some of the moving around the building and entry and that sort of thing on the 14th and 15th, for a part of a day, a few hours, a couple hours. But just to sort of get used to how it's going to operate with a smaller group of kids. So that's what we're hoping to do as sort of an intro or preview for students. But that would require us to start on the 16th. We could go earlier than that, but we'd have to put the beginning for staff before the week of the 31st and into the 27th or 28th. But those changes are summarized in your packet there in the email I sent to you just before we started. There'll also be further adjustments on early release days. We have an early release day scheduled for September 22nd and one for October 6th. We would recommend removing the early release day on September 22nd because we'll just have started, and then postponing the early release day in October to May. And that's a 6 to 12 one, I believe. Yeah.
So Ben, are you saying start August 31st for teachers?
Yes, which is what we were
So,
before. Yeah.
well, there's a clause in the contract. I don't know if you reviewed it. And I don't have the contract ready with me right here, but I can look it up. But we just need to look at it and confirm that school starts based, the contractual language is based on Labor Day and where it falls. If it's not according to the contract language, we would have to go in and negotiate with the teachers to start earlier. So did you have a chance to look at that? I can't off the top of my head remember exactly the language of it.
Melissa,
Probably get it quickly, but
Melissa, I think that might have been our original start date for teachers and kids starting on Tuesday.
Yeah.
That we had already approved.
Okay.
I don't think it's different than, I don't think it's shifted anything.
That's right. That's exactly right.
okay.
What we were thinking of doing was we had the November 5th release day for teachers. I mean, school's off in the original calendar. We were thinking of moving that to September 1st, and then pushing out the start of school one day. But then that was all before we had these 10 days from DESE, basically. But Kathy's right that the original staff start day was, Greg, make sure I'm saying this right?
Yeah, I'd be happy to clarify. It's all right on so far. The original staff, what we had done was we moved the November 3rd election day professional development session to August 31st to gain a little bit more time before school started. With the introduction of the 10 days, the only way to get 10 student days in by the 16th was to move the November 3rd day back to that day, and also the traditional staff in day would move to the end of the year for a last day after students are finished for cleaning up, possibly some professional development, but a wrap up on the school year. So those days would move back to November and to the end. Just a couple clarifications on October 6th. That would remain a professional half day for 6 through 12 due to some things that they have that are time sensitive that need to happen. And the elementary portion of that day would move to May 11th. The only other change, I believe, I think that is it. We did look at the contractual language in the original approved calendar. Friday, September 4th was a teaching day, but in looking at more closely at the contract, we realized that the contractual language calls for the Friday prior to Labor Day to be off if we start before. So that is reflected in this calendar.
Thank you, Greg.
So Ben, I'm not sure what your expectations are of this tonight, but it's not on the agenda as an action item to change the calendar, the school calendar.
No,
but obviously we're having meetings in the next couple days. I mean, it's not like we can't put it off a couple days and put it on our next agenda.
yeah, no, it's just part of the update tonight, and then we'd like to vote next week on it. Yeah.
Okay. Joel, did you have a question? I can't tell if your hand's up or down, or maybe.
I don't know. Well, I wanted to wait until it was totally done, I suppose.
Yeah, so
Okay.
you've already seen this tonight, all the different meetings we're having, you guys are having, we're all having to get input and feedback and Q&A. And then just in terms of next steps, today's August 5th, online parent forums for the next week. August 12th, you would vote on what's to be submitted to DESE and the primary learning model that we would begin with, understanding that's, could change. We have to begin negotiations with our union partners. And then really the bulk of the work from here is, just, as I mentioned, operationalizing on so many levels, school schedules, food service, transportation, safety protocols. And then just, as we just discussed, schools open on August 31st for staff. And then 10 days later or so, September 16th, we're recommending September 16th, the school to open for students. Just quickly on the schedule, September 16th is the last day that DESE is allowing school to open. That's the last possible day. The school's got to open by the 16th for all school districts.
Ben, can I ask a question? Yeah, thanks, Melissa. You had said that the 10 days that that DESE has reduced the calendar are required to be done at the beginning of the school year. Is that true, that it's required to happen?
On all our calls, the commissioner has said, you've got to use those 10 days. You can't, he said, and you got to use them before school starts. You can't split them up. You can't divide them across the year. So I try not to go on what Boston's doing. I'm not sure what Boston is doing. Sometimes the rules don't apply there. But he's been pretty clear to us that you use the 10 days, use them before school starts.
Yeah, it just seems sometimes with, professional development and other kind of planning that you may get that training, put it into action, and may need either a refresher or to alter your plans after you've seen it in practice for a few weeks. So it just seems.
No, what I agree with that. What I was saying initially before the commissioner became, really clear about this was, let's figure out what we need days for and what to use them for, and then figure out how many days we need, rather than taking 10 days. Now, there's no shortage of things to do and practice and get good on and that sort of thing. So, but I agree that, anyway, I agree with your point, definitely.
Can I ask something?
Yep, go ahead, Laura.
So just two things. One, personally for me, it's imperative that I hear from Mike Hale before we vote next week on the status of the buildings. So I don't know if there's a way to make that happen, but that feels really critical to me for my information and maybe to others on the school committee.
Yep.
So that's number one. And the second thing is, I'm just wondering, because I know that a lot of people were upset about not being able to speak tonight. Can you say more, Ben, about how the information that's gleaned at the Q&As and the community forums, how that information is going to be sort of recorded and used as we go through this process?
We'll record one of each of those sessions. So those people can watch those in any way they want. I mean, we'll incorporate or learn from those, based like we always do, which is listen closely and then apply the learning. I don't want to, you'll see, as we make adjustments, you'll see them. And those adjustments will come from a variety of places, both your input and questions and the communities and everything. I'm not sure we're going to be able to say where they came from necessarily.
No.
Yeah.
I just want to sort of present to the community, the assurances that they're going to be heard on this.
Yeah.
That's what I want.
One thing we could do is sort of report back to all of you about what we heard, that might be helpful. And so, and what would happen typically, like normally what I would do in forums like this that are happening in the real world, not the COVID world, is, we let it write down every comment that's said, on chart paper and document it, and then, really just post those and summarize them. So I'm not sure we'll be able to do that here. They will be recorded, but we can report back to some major themes, that sort of stuff.
I mean, even less reporting to us and just sort of just to make sure that all this information is going to be incorporated. That's my main point. As I look at the schedule, I see that, it's all a very condensed time frame. So we're voting a week from tonight, and there's a lot of work to happen between now and then. I totally understand that. Don't want to add to your work. I just want to make sure that everyone understands that we are listening and we are hearing their comments, and we are all eager to hear their comments.
Yep. Great.
Can I add to that?
Yep.
Thank you.
And then we have to take a vote after that. After that, we have to take a quick vote because we have a school committee policy that states our meetings can't run later than 11 o'clock, and we have to do a vote if we want to continue.
Okay. So is there a way for us to hear about what's being discussed in staff meetings? I realize that there's going to be negotiations, but that's a whole different ballgame than sort of hearing about how teachers are feeling about some of their concerns or what their needs are going to be. Is there sort of another venue for us to hear? I know that they can speak on Monday, but is there a way for somebody to report out on really the topics or some of the themes that are coming out of those meetings?
Yeah, sure. Yes. In terms of, again, we can do major themes. I mean, just quickly, a lot of what I heard recently on a few different meetings were just, and we met, all the principals met, and district leaders met on Wednesday, and we shared at that point all but one school, I think. We met on Tuesday. Today's Wednesday. But yesterday, okay. At that point, I think all but one school had a staff meeting, and so the principals all shared, to all of us, what they were talking about. One of the things that kind of come up was just actually very detailed questions about specific, operational pieces. So I just that's one place folks are like, how are we going to travel to the building? What happens if a student gets sick? How will we get PPE, that sort of thing? I'm not doing a good job of characterizing them, but just so that one thing we heard was just sort of very specific, concrete questions, wanting to know how things are going to run really. So that's one area where people are, but we can also help summarize and again provide major themes on those sorts of things. Yeah.
Thank you.
Mm-hmm.
Okay, so it is 10:52, and I'm just going to quickly read file BE. Because all regular meetings, meaning school committee meetings, shall conclude at or before 11 p.m. unless extended by vote of the school committee as follows. The first extension of the meeting shall not exceed 30 minutes in length and shall require a majority vote of the school committee. Any subsequent extensions shall be approved by a unanimous vote of the school committee members present. If necessary, the meeting may be continued to another evening, but such continuances shall comply with the posting requirements of the open meeting law. So we still have several items on the agenda, and we do have an important executive session to address, at least part of it. So I guess I am going to ask, what is the will of the committee? Is there a vote that we can extend by another 30 minutes at least and try to determine what is important on the agenda and what can wait till either Monday or next Wednesday?
I move that we extend the meeting for another 30 minutes after 11 o'clock.
Second.
So we have a motion and a second. Maria, can we do a roll call vote?
Mr. Favazza,
Yes.
Vice Chairperson Prince,
Yes.
Mayor Taken,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
and Kathy Clancy.
Yes.
Great. So, so Ben, how much more time do you think we need to discuss the update?
I'm done. It's just about whether or not you folks want to deliberate or discuss or have more questions to ask.
So I would ask the committee, is there any more questions on the update that would need to be asked tonight? We will likely, I'm assuming, Monday, that after we hear a ton of feedback from the public, that we may have a chance to revisit some of our questions. So are we settled for tonight on, are we comfortable leaving this discussion tonight on the opening? I guess is my question. And I'm seeing nods, so I'm going to take that as a yes.
I have one last question.
Okay, go ahead.
Or maybe it's a request, and it would just be to consider, especially leading up to Monday and then leading up to our vote, all of these plans are, and I gleaned from the report tonight, based on the, not pressure, but the push from DESE, all these plans are to kind of come out of the gate strong and then have a plan for retreat if necessary. And I would just like the inverse of that explored, which would go, you know, a remote beginning and transitioning into a hybrid rather than a hybrid start. Just explore what that looks like functionally, budgetarily, pragmatically. I think that would be important information to have considered prior to Monday's meeting and certainly prior to our vote.
I would agree with that.
Can I have some clarification on that?
I guess what I'm saying is the plans that we're looking at, the order of operations all start with preferred hybrid model, but we also have this backup remote model that we're exploring in depth because there's a not unlikely chance that we may need to use the remote model at some point after opening if community transition goes up or if schools to go down because of an in-school outbreak. And what I'm just asking is to explore the possibility that instead of starting a hybrid and going down to a remote, if the hybrid proves dysfunctional or unsustainable, that we just explore the option of beginning remote and ramping up to.
I understand. I understand the question. I want to ask some clarifying things. So I'm not sure, other than putting one before the other. I need to understand this. What else would we give you to show you what would happen? I don't understand how I would give you. I mean, there's an order. I understand the order. I get that part. But I'm not sure what other information would be necessary to help you understand that.
Well, I guess maybe you just answered it. Functionally, is there no difference going from hybrid to remote or going from remote to hybrid as far as the district is concerned? Obviously, there are huge concerns within the community as to how that impacts, you know, the ripple effect. But from the district's perspective, transitioning from one to the other, as long as both plans are locked and loaded, you will be able to go from one to the other as necessary in either order.
Yeah. Typically, I don't like to use gun references when we're talking about school plans, just in general, but
fair criticism.
So I don't see any difference in you know, doing remote, whenever we do remote, and what it looks like and how it's planned for isn't different whether we start in, you know, in January or October or September, okay? There is a real difference in terms of like starting a school year off and developing the connections and let's be straight with you on this. You know, for the most kids, the reason that school works is because of relationships with their teachers. You know, and when those relationships are strong, no matter what age you are, is when, you know, school works best for the kids. And so what school in the beginning of the school year always is making those connections. And that's one of the real primary reasons, if the health indicators and community transmission allow us to start school in person. That is the reason, okay? Because even if we have a week or 2 weeks or 3 weeks of as much in-person learning as possible, the relationships and connections and systems and procedures and just like familiarity that's built in that short amount of time, whatever time it is, helps us get through the rest of the year. Remote learning, as hard as it was in the spring, would not have happened at all if we began that way in the fall, okay? It would have been much, much worse. So while we can do either one to start, if the health indicators allow us to start in person, there's just no comparison, honestly, in terms of setting students up for success throughout the rest of the year. Even if literally, even if we are in, as much in person, but I'll just talk about the preferred models we showed you for a short amount of time.
So can I just push on that a little more and say, so for instance, although apples to oranges, during the pandemic, I had to hire, additional staff member, and I had them come into the office, although everyone was working remotely at the time. I had them come into the office for 2 weeks, kind of to develop the relationship, show them how to work, and then I sent them home to work remote once I felt they had, built the connection with the office and learned how things work. And so would it be prudent to explore the option of, okay, we're going to begin in person because of the importance of building those relationships, et cetera, and then we are going to target a date in which we, go to remote or set earlier triggers, basically, not waiting for the car to overheat before you shut it off, but catching it before, not waiting for an outbreak at the school, not waiting for Gloucester transmission rates to go high before you have to reactionarily pull back. Is there a set minimum number of weeks where you go, okay, I think it takes 4 weeks to lock in some minimal relationships. And after 4 weeks, remote is less devastating than it would be in the first. I'm just trying to think like that.
Well, so a couple of things is that's a great, I really appreciate the question, because what I want to clarify is, and Karen Carroll mentioned this earlier tonight, is we're gonna be able to see this thing coming, okay? There won't be all of a sudden automatic, just, how do I say this? Going from 0 to 70, sort of thing. And there shouldn't be, because we'll be watching that closely. So now, that's not to say that, I would say that like every week, if not every day, we're making that assessment about where are we now, do we continue, that sort of thing. I think it certainly can make sense to say, let's really look at this every school committee meeting maybe, or every 2 weeks, that sort of stuff, as you were saying. But we can't lose track of those numbers on any day, literally. So when we do see things that start changing, they're not, my understanding away from talking to Karen is, and she said this tonight, is they don't, just totally shift into high gear, which is, I think, what people are really worried about, that all of a sudden we become Florida, but even Florida didn't become Florida in the span of a night or two. It actually, most people saw it coming a long way away, and that's what we have to do here as well, I think.
So Ben, we did surveys, and the surveys resulted in telling us that parents, taxpayers, the ones paying for our education, want an ability to get their kids back in the classroom. We know that a lot of private schools, you can look it up, a lot of private schools started early, knowing the weather is good. They started in August to make the best of the good weather now, and have gone back into the classroom. And I don't know if anyone else has, but I've gotten phone calls from parents asking about if schools aren't going to go back open, can they homeschool and join the virtual Commonwealth online school that you attend, that it's like a school choice out, where they can get the instruction and they keep their kids home. because they weren't happy with the remote learning last year for a variety of reasons. So there are parents out in the community that have expectations that we open early. They just don't want, not open early, but that we open and safely. And I think we need to honor that. I'm a little concerned about doing it backwards, where I think we should take advantage of the good weather now and then have to close as we know the data is going to get higher, because it's known that once flu season comes, the numbers are likely going to rise. Either that or there's going to be panic every time someone coughs or sneezes, because they're not going to know the difference between flu and COVID-19. I do think we should have some sort of plan in place, just as an option, but I don't know that it has to be such a plan that that's the direction we're going in. And I think it's fair that we all keep an open mind until we hear feedback from everybody. While I know there was a big push tonight that hoped to get a complete remote learning, I don't know that that is the will of our community. And I think as school committee members, we have a responsibility to what all the parents want, not just some of the parents. So we have to have all of the discussions, but not necessarily direct it in a way. So DESE is saying they want us to open. You know, they're coming out with regulations. I don't know what stops us from disagreeing with that. If the community spread is not bad, if the health data is supporting it, if there's not a lot of community transmission. I don't know who I am to say that so-and-so's kid can't go back to school if all the safeguards are in place. So this is obviously part of a bigger conversation to have after we get feedback. But I just don't, I mean, I get Joel's question, and Samantha I know supports it too, and probably others, that maybe we should talk about what a remote start and then hopefully an open-in looks like. I just don't know if that is a direction we should be pushing in until we hear from the community otherwise. And I say the community, not just the staff, but the community as a whole. So, I mean, I don't really know what my message was there, but I don't want to take a lot of time taking steps back. And this is a decision we'll kind of have to make quickly, because we're going to be negotiating impact bargaining with the teachers, and the school committee is going to have to take a position on how those negotiations are going to go, and that's what we need to talk about in executive session. So I think we need to be prepared for all, and that all options should be on the table, but we really have to think about where we're going with these expectations of starting all remote first, when we just heard from the Board of Health that there's nothing to indicate we should do that. So I guess that was kind of an opinion thrown in there, and I apologize, but just trying to figure this all out like we all are. Sam, you have a question?
Yeah, just so I'm not advocating one plan over the other, but what I heard Karen Carroll say very clearly is that we don't have a lot of science. We don't have a lot of data. Our testing is delayed. And there's a lot of challenges to mass testing. So my concern is that when all of our schools start up at once, those delays are not going to get better. So I have a lot of questions about those sort of safety concerns, right? Like, how are we going to know that we're keeping people safe if we're not getting test results back until 14 days? And so there's still so many
14 days.
I mean, that's people's reality. Like, some people are getting it back in 2 days. Some people are getting
Can
it
I
back.
speak now? Can I answer some of the questions? I've been very good and quiet. I want to answer some of the questions on the city side. Is that okay? I'll answer
Wait,
some
who's
of
that
the
speaking?
questions. It's the mayor.
I'm sorry. I didn't recognize your voice. You sound tired like the rest of us. Go
No,
ahead.
I'm laying down. I'm
Sam,
listening. I'm
hold
tired
on.
because we do this all over the city side. I just met today. I asked Ben to join me with the mayors. We had a special meeting with some professionals and some people to help us from Harvard, how we're going to open the schools and the concerns of all mayors and town managers around this morning. It was actually a very long meeting also. Very concerns with everyone who has to open their schools and what we should do, and we should be on this together, and we're going to have a list of demands to the governor that we would like to say that, you know what, we appreciate that some of the testing that we are doing here now, that we're helping other states, that we need to stop because that's the delays. What's the sense of having a testing if you don't get the results back for 10 to 12 days? You might as well just stay home and quarantine. How do we handle that? What should we do as far as protocols? How should we do other things? I put my things, I have a lot of talks with a state representative and a senator and lieutenant governor on some of the issues and how we need different kinds of protocols in school that we're not familiar with. My example, I would say let's say, I'm not saying when, it's September, October, November, December, when we decided that we're going to start the schools or we go into schools and you have your paraprofessionals. I need to know how many, special needs students we have that could have accidents, or what happens if a child's sick in school and vomits in the classroom. I've been looking at every avenue you can think of as having, let's say an example, little girl walks into school, they're sitting in their classroom and he don't feel good or she don't feel good, starts saying, I don't feel good, and then vomits. What do? You don't have, what are we going to do? So you would have someone contact the office, and we wouldn't have the nurse come down. You wouldn't have a teacher to clean that person. You wouldn't have a paraprofessional like we used to. Let's go to the restroom. You would have a home health aide, a trained health aide that's trained in COVID and trained and with all PPE, come into the classroom, take the child, go to the bathroom that they have to go to. The custodian will be there, lock down the bathroom. The teachers could also have a protocol in place where, okay, so now this room has to be disinfected immediately. This has to be cleaned up. The children can go in either with space that's designated, let's say the cafeteria. That meantime, the custodian is now in the bathroom. After that bathroom's clean, you have another custodian right away cleaning down the classroom immediately. Then it's going to be a lot of work. And then the classroom goes back in and they clean the class where they were going. And that's a lot of work on custodians. That's a lot of things that we have to go to when you were looking at, do we subcontract out? We've been doing that anyways, as far as right now with the big machines that come in to clean this, those disinfecting machines that we're talking about to clean your walls, to clean your things. If we had a company coming in to clean the schoolrooms after, we would have naturally a certified quarry, everything that you would know, but they would come in with machines. They would come in with disinfectants. Like they said, that COVID, when we were learning that COVID would stay on the walls. COVID would stay, and the protocols could stay on your desk. So we want everything cleaned. You need the machines. Then we were thinking, okay, because this is all extra cost. Remember, and I don't want to be a smart ass, but when I was talking about the Rangers, everyone joked, but now everyone else went through. My biggest concern is now getting these companies, getting these home health days, getting these, we talked to Mr. Loomis right away, start getting the applications out. Because even if we do not open in September, October, I'm not saying when we are, we're not, we're still going to have to hire these people. We're going to have to still do something in place and make sure that we have enough, because the fact is there's going to be a shortage of demands. The same thing, we had an incident. We're very fortunate, very, very fortunate, because Gloucester's unique. We have connections with 10 days, rapid, whatever. We've been doing testing and having testing done way beyond other people in other communities. We have, besides having a local hospital here working really closely, we've had connections with other urgent cares, other like Quest labs, like other labs. We've asked and we pulled together to have like a testing site here. And they said, well, it goes by protocols, goes by how many, like Karen said, how many in the population that had COVID. We've been very fortunate is because we worked, we complained, we're very close with secondary setters. We've had homeless people tested 3 times within a month when we were at the YMCA. They came here. I had a little incident this afternoon, and I called some emergency friends and says, look, I might have people need to be rapid tested, or how do I do this? What's the protocol? What's the best thing? Rapid tested is okay. If, like someone's come back from traveling, but it's not secure, you don't want that 15 minutes. The other one, it was 24. What happens is, so we're looking, hopefully it'd be better, and it's getting better. The testing's getting better. If, let's say, that little boy that threw up, okay, so what do we do? Do we quarantine the home health aides already looking at the symptoms? We call the mother or the parents, grandparents, whoever, the guardian. They come and said, yes, you have permission. We're going to test this. We'll keep still isolated the little boy or girl Meantime, you still have a classroom. What do we do with that classroom? Because that classroom now has been exposed. Let's say he did take the bus too. So you got the kids on the bus that could be exposed. So you're going to have every kid's name already on those buses, who the buses travels. You call the bus driver and the whole thing. Yeah, it is scary and it is a lot of protocol, but you got to put all the protocols in place. You have to have all of these procedures in place. What you do, you got to have a place where we say, okay, so now we have 25 kids in the classroom, paraprofessional teachers. They're going to have to be tested. Can we have someone come down? You got to get the parents' permission. You got to go through all that. What happens if we have a parent say, well, no, my child's not going through that. You're not putting nothing in my child's nose. They're not going through that. That's ridiculous. The cold or the flu. Well, then that's fine. Then your child can go home until you find out the systems of quarantine. Meantime, we get the testers. So we are working on all those protocols. We are working on the cleanup. We are working on the contract. And I did talk to, because I'm sorry, I don't want to be stuck with nobody. I did call some of my companies that we're working with and said, look, I can't guarantee you a contract, but I'll probably end up cleaning a lot of other places, because, once all the schools do open and stuff, unless I hire like another 100 janitors, it's impossible. Even if they all worked overtime, this is not a 3-day snowstorm. We don't know. I need to have people in place, and I don't want other schools to pull these people. Just like you guys were paying your buses through the whole COVID, through the whole summer, because you're afraid that when it does open, you're not going to have contracts with these companies or these schools or bus drivers, and then we're stuck. Well, I started making my own phone calls and looking at things and looking at companies and see what we can do for protocols and what other ones. The same thing, like we have security already in the placing in the annex, and then we have it at City Hall when someone comes in. Our main priority, okay, is to make sure that everyone is safe. Our teachers, our students, my custodians. See, you have to understand, I am talking on both sides now. I'm a member of the school committee, but I am the mayor of this city. And I have to make sure that everyone's safe and protocols first. We also are working with therapists. We're all working with, because being home, how's it affecting? If it does, even if we decide to do the hybrid, if you decide to do, the whole thing remote for the first 3 months until a vaccine comes in, but still, what do we do with our special needs children? What do we do with the children that we know that really should be in school, and how do we do that? How do we know the level of our students? See, when we were looking at, in my view, we should have started a little bit earlier. In my opinion, we should have started school maybe July and August, worked out with the teachers where we knew it was low, find out exactly, maybe 1, 2, 3 months to find exactly where our students were, at what level they were, get them used to the teacher, get them used to the new classroom, meet the teacher, meet that, not in a computer room like this, because if you're all complaining about Zooming and they all want us together, because I have no qualms, I have not stopped working. So do we have, you all complain about, well, I don't want a Zoom meeting, we all need to be together. Well, what, don't you think a child feels that way? Don't you think a child feels that if you're all complaining out there that we should get together, why don't they get together? We're not seeing the face, the computer, it's backing off. I don't have Wi-Fi. Well, don't you think my children out there don't have that either? Don't you think how many children, or how many parents that came to us, or we've given them the existing Wi-Fi, the hotspots and everything else, and still don't, and it still comes out that? Or how many children actually cannot right now, are not doing well because they are with their parents, and swimming's going to be over pretty soon. All these wonderful activities, they're going to be stuck in the house again, and parents don't know how to handle that. We're very fortunate that Pathways opened up again, and look at the protocols. They are inside. Let's ask them what they're doing. Let's all decide that we're going to work together. We're going to, I'm not on your committee. I have staff on your committee, so I'm learning just like all of you what the plan is and what we should and should not do. I think that after we hear from all the parents, all the ideas out there, the teachers who are going to be there know, the ones who know their students, but also I'm glad that you had the Patty on there, and the special needs and the therapist and everything else. But we're going to have to figure out something. We're going to have to look at the schools. Every mayor said today, and every town manager, whatever, said today, every school district is different. I cannot compare myself to Lynn. I can compare myself to Somerville. Kim Driscoll said, look, we have older schools. To be here, Joe said, my high school's falling apart. I don't think I'm going to be able to open it all. Where am I going to put them? We're doing construction. We're doing this. I mean, he says, where do you put them? You got to look at the structural of the school, the ventilations of the schools. You have to look at everything you possibly can look at, the size of the schools, how many kids you're going to put in that school, the air quality, all of that. All of that, he says. You got to look at what do you need for English as second language? What do you need for, different culture classrooms? What are you going to need? It's not just, okay, let's open up. You cannot do that. You cannot do that. And then if you tell me that our schools don't have the ventilation and our schools possibly cannot do that or have that, then don't bitch at us that if we want a new school. Okay? We have a new school. We have West Parish. So, and is beaming better. We need to take a really good heart at our schools and say, well, you know what? Why don't we could do for the hybrid and do just the 2 schools and put the first and second grade first at West Parish because it's open and beaming or whatever you decide or whatever people decide. But you cannot compare and put it in a whole of the whole state of Massachusetts, people. We're different from Rockport. We cannot look across that bridge of what they're doing. We need to look what we're doing for Gloucester. They said, mayors, whatever you do, the doctor says, you look at the numbers that you have, you look at the uniqueness that you have, you look at the schools that you have. Don't compare yourself. You can compare to stuff that you can demand things from the governor. We all want the same rapid test or the right test, and we all want this, the PPEs, we all need this, the reimbursement. As a state, we can. But as how you run your schools and how they open up, it's up to us what we need to do. It's not a state thing. I'm sorry if people are going to say, well, it is. And no, it's not a state thing because we are different. And what's hard is like some of the teachers were saying, and you know what? They were right. It's like, I don't live in your city. And my city's doing it different. Now, she could be, that doesn't mean that person's selfish saying that, well, what do I do in my city? Because then we got to think of their children. And then we got to think of the fact is they could be carrying it. So there's a lot that I learned tonight, and I was listening to some in the beginning. And you know what? We're going to have all next week. But you know what? Until and I'm glad we got an extension because it's not going to be an easy thing. It's not. We're going to have to listen to everyone. Ben just came aboard, and he has not stopped. And thank you, Ben, because I said, get on the Zoom. He said, well, you don't have an idea. Just do this. And Carol jumped on, too, because this was so crucial that I'm surprised that when they said that we didn't have we didn't have a superintendents together. I'm going to ask for that next time because they were so spot on. So I'm looking forward to all the meetings, even though I was quiet and I'm relaxing or whatever. I'm going I'm going to let other people talk and ask their questions because I have a little bit more advantage because I'm listening to this 24/7. So I'm looking forward to hearing some of the remarks about the teachers, their classrooms, what they need and they don't need. Do we do, suggestions they might do if I have 20 kids, 10 kids. But I will protect my janitors. I will protect all the school employees, the cafeterias, whoever we have. I'm telling you right now, I don't have to go in front of any city council or anything else as far as emergency COVID or whatever. I will get the home health aid training so my teachers can teach. My paraprofessionals can be with the classroom. I don't want a teacher walking out. That means she'll be missing for 20 or he will be missing 20, 30 minutes, whatever. Someone, has a little accident or the paraprofessional. We want people who are trained. We want people who understand, who can understand the system. And I don't want my nurses because my nurses are your nurses right now, but they were my nurses for the longest time and helping us through the whole summer. And this whole COVID, which they're going to be returning to the schools, which we have to hire some more for and let me tell you something, whatever they may want to call it, your tracing and whatever, can I tell you something? If it wasn't for our nurses, the Gloucester Public Schools and the city of Gloucester thinking about this ahead of time, no one else thought about it ahead of time for tracing. Whatever they wanted to call it, we were doing it for day one. The first incident, as we all know about a prayer group or whatever, I did some of the tracing myself with the hospital. We didn't even know what the hell it was. Karen took 24 hours and we had someone that didn't speak English and we started doing that. That's what I'm saying about Gloucester. We fight together, we stay together, and we will come together to make sure that everyone in this city is safe, including our children, the best we can.
because nobody knows about COVID. It didn't come with a book, people, and every day it surprises us. We started off with yes, no mask. We started off, children don't get it. Yes, now they do. It's going in transit, and we will learn together. Thank you, and good night.
Thank you. So to sum all that up, this is how I see it, because we're going to have to make decisions to keep going here in a few minutes. We all know that there's a plan in place for parents who don't feel comfortable sending their kids to school. That's a given. So for parents who don't feel comfortable now sending their kids to school, they don't have to, and there is a complete remote plan in place. The question we have to consider is the amount of parents and the people that are asking for the ability to send their kids back to school. Is there a way that we can provide those services in a safe way, not only for their children, but for the teaching staff and all of those involved? To me, that's what we're looking at. So we know there's a plan already and there's an ability for parents to keep their kids home. That's in place. But is there an ability to open up for the special needs kids, for the kids that are at home that don't have parents that are able to sit with them, for the parents that have to work? There is a group of children out there in our community that need to come back. The question is, can we do that and help them in a safe way that we all feel comfortable with? Does anyone want to add to any of that before we end this conversation and move on to the next topic and take another vote to stay another half hour?
I will say quickly, I agree with you. There are kids
Thank you.
that need to be, that need our schools in person.
No doubt. Okay, so it's 11:30. Is there a vote, and it has to be unanimous, to go another half hour so that we can go into executive session and have some sort of discussion as a school committee to prepare for meeting with the teachers next week, to hopefully collaboratively find a way to figure this all out.
When does negotiation start with the teachers?
I don't believe Naomi has locked down a date yet, but it looks like it's probably going to be either Tuesday or Wednesday.
So we could have this executive session on Monday?
We could, but let me just say this. I have had the wonderful experience of watching Somerville and Cambridge and other school communities that had a public hearing, and rightfully so, to hear from their community about all the issues and concerns of whether they should open or not. And those meetings have gone from 2 to 3 hours. Now, I don't know that that's going to happen in Gloucester, but as we saw tonight, there was 250 or more people on our attendees. I don't know how many of them wanted to speak, but I have to believe there's going to be a lot of input for us to take in on Monday. And there's other things that have to be on our agenda on Monday too, specifically the things we're not getting to tonight. So it doesn't matter to me. I can go either way. I'm going with the will of the committee. If someone wants to say it's 11:30 and they have to work tomorrow early in the morning and don't want to carry on, I am okay with that. It's the will of the committee and what we think.
Does it
I mean,
have
it could wait till Monday go ahead. I'm sorry.
Does
Sam.
it have to be after the public hearing, or can we schedule it for another time on Monday?
Well, we need, before the committee meets, before the team meets with the teachers, we really need to have some feedback from the full committee so that we know we're going in the right direction.
No, I meant the
We can
executive
post it in
session.
the afternoon, right? We post it in
Could
the afternoon.
could we do the executive session into Monday afternoon, or like another time, or does it have to be after the public hearing?
No, we could probably schedule it a different time. I mean, I don't know everybody's availability and work schedule, but I'm sure we can find a way. I mean, I'm totally okay with that.
You could do it at
Somebody
6.
talking? I'm sorry.
Sorry, maybe you could do it.
What?
Maybe you could do it at 6 o'clock, just before the special school committee meeting.
Yeah, we could probably do that. I just need to do a posting because what's today? Thursday. We would have to post it Thursday to Friday to Monday. We'd have to post it tomorrow morning.
Yeah.
So I'm okay with that if we want to do it before. Laura, go ahead.
So I'm all for that, and I know it seems really unimportant, but I would love if we could just approve the social media policy so we can move forward with that, because that keeps getting delayed. And if we could have another forum to promote the things we're talking about, I think it would help us.
I make a motion to approve the social media policy for the Gloucester Mass School Committee as attached to our agenda tonight.
Second.
Second. Maria, roll call.
Mr. Favazza,
Yes.
Vice Chair Prince,
Yes.
Mayor Taken,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
and Kathy Clancy.
Yes.
So in
Okay.
the minute and a half we have left, the only thing I'm going to say is under new business, we have to discuss Zoom meetings and the ability to go back. We got a request from the community tonight to have our next meeting in person, but I think we need to have a discussion about that as a committee first. So I am going to say that that is probably going to be on our agenda on Monday. So just be prepared for that conversation. Looking at the agenda, I don't see anything else that can wait, and I'm assuming we're all agreeing that the executive session can wait till another day. If that is how we're feeling, is there a motion to adjourn because it's 11:30?
So moved.
Second.
Second.
Awesome. Maria, roll call?
Mr. Favazza,
Yes.
Vice Chair Prince,
Yes.
Mayor Taken,
Sure, now that you woke me up, yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
and Kathy Clancy.
Yes.
Thank you all. It's been a long night. We got a long road ahead of us, but we'll get through it together.